Okay. Good morning, ladies and gentlemen. Good morning, everyone. Let me introduce myself. I'm Abir El-Baheri, the head of the National Antimicrobial Team and Pharmacy Development Administration at the Egyptian Drug Authority. Welcome today to our session of the Egyptian Drug Authority. As we know, antimicrobial resistance affecting people at any stage of life, animal and plant. So in our session, we'll focus on the global threat of antimicrobial resistance and its effect on, or its impact on human and environment. Let me first introduce our speakers today. We have Professor Tamer Assam, the chairman of the Egyptian Drug Authority, Professor Hanan Hassan al-Balkhi, the Assistant Director General Antimicrobial Resistance at WHO, Professor Dan Sally Davis. She is the UK envoy on antimicrobial resistance, and also she is the member of the Global Leaders Group Antimicrobial Resistance Group. Dr. Takehiro Nakamura. Dr. Nakamura is the head of the International Environmental Technology Center, United Nations Environmental Program. Dr. Naim Al-Qusayr, the head of WHO at Egypt, will attend with us this session. It's a great honor, Dr. Naima. And finally, Dr. Shireen Abdel Gawad. She is the head of the Central Administration of Pharmaceutical Care at Egyptian Drug Authority. And now, let me start the session. Let me invite Dr. Tamer Assam to share with us. Please, Dr. Tamer. Dr. Tamer will share virtually.
Good morning, everyone. Is it clear the voice?
Yes, doctor, please.
Yeah, it's a pleasure to be with you, and I would like to introduce my sincere apology for not being able to come to Sharm el-Sheikh to join this quorum of brilliant, eminent, and especially our dear guests, Dr. Hanan. I'm really happy to see you again, and I know you are virtual too. And also my dear Dr. Naim Al-Qusayr for her presence, and all the other distinguished guests. It's my pleasure to be with you, and I would like to introduce the EDA initiative for fighting or combating antimicrobial resistance, which is a serious threat globally and worldwide, that everyone has to do all the best in order to try to mitigate all the consequences would be a real threat for the whole world. So there is a little presentation that will be presented. The presentation is now online. Is it available now? So the presentation is available for you now,
yes,
right?
Doctor, we can see it. Okay. We can see the presentation.
Yeah. For the antimicrobial resistance, as I said before, it's really a global threat, because every day we are watching a lot of serious cases that cannot be treated because we have no access to effective antimicrobial, and there is a lot of statistics worldwide stating how serious this threat is going to be, and how far it's going to be more serious and more dangerous for the whole population all over the earth. So what we are saying, because we are now in COP27, it's not only affecting the humanity, it's affecting the environment and the environmental balance and the ecosystem, which is really a real threat for everyone to see and watch. That's why Egyptian Drug Authority and the officials in Egyptian Drug Authority try to inspire from the WHO guidelines and initiatives to make main pillars and initiatives to ensure that we are working together to our main objective and aim. For the first one, we are trying to roll up or sum up the main initiative, the EDA, the Egyptian Drug Authority Solution, stands for state leaders. The first one is that we are trying the Egyptian Drug Authority to make insurance for all access and the effectiveness and the quality and the safety for the antibiotics provided to the patients. We are trying to ensure that we have a good citizen awareness and we have making ensure to make information available for everyone. The second letter stands for develop. We are trying to develop a framework and network through specialized committee that has to be making more dynamic decisions and keys to combat and mitigate resistance and making more rationalized use of these antimicrobials. The third letter stands for A for adopt and establish more regulations and laws in order to ensure that we are on the right track regarding the GMP measures, that we are making proper market control and making even market monitoring and control in order to afford proper mitigation solutions for this. The letter S stands for surveillance, that we are making extensive surveillance to ensure that what we have done, like an initiatives or accommodation, is coming through in the right. So we are making surveillance regarding the consumption rate of antimicrobials, how far we are able to succeed to mitigate and reduce the use of antimicrobials, making more rationalized use. And that's why we are trying to share this surveillance with the Global Data Glass AMC. And we are sharing with everyone to see how far the world is progressing in this area. And the letter O stands for open because we are totally open as Egyptian authority to cooperate with all our stakeholders and our institutions in Egypt and outside Egypt and of course WHO to learn, to inspire and to get in touch and exchange all knowledge, to have enough data to see more tricks. And of course, we know that there is another initiative now looking to shifting back to all the antibiotics because microbiologists started to say that there is a cost effectiveness and cost fitness for this antimicrobial resistance. That's why it's a brilliant solution to start shifting back. And I'm talking quite good in this area because it's part of my background. That shifting back to all antimicrobial could provide a little solution. However, the main terminal solution is through rationalized use of antimicrobials and making more effort to make more awareness how we make proper and rationalized use of antimicrobials. The last level, which is the important one for myself actually, is the leveling up of the business and training and education. Proper education and awareness for the people, for the professionals, will provide us the prevalence-wise solution, have a fast actions on ground to achieve what we need sincerely for mitigation of these rationalized antimicrobial use and provide terminal solution for the resistance which may be great consequences. In this regard, Egypt will introduce the two initiatives that we are working and we are start sharing with our people from the attendee this initiative and we do all our best through and to make it happen, inshallah. For all the patience and the support, I'm looking forward to hear more and more. Thank you for everyone.
Thank you. Thank you, Dr. Tamer, for your informative presentation. And now we'll move to our next speaker, Dr. Hanan Hassan Balkhi. Dr. Hanan, please join us.
morning, everybody. Assalamu alaikum, and I hope everybody's well. Can you hear me, please? Can you confirm?
Yes, yes, we can hear and see you, Dr. Hanan. Welcome.
Excellent. And can you see my slides? Can you see the slides, please? Can you confirm?
No, not yet, Dr. Hanan.
Okay, I uploaded them already. Maybe it will take a second.
Okay.
I uploaded them through Zoom. Can you see them now?
Not yet, Dr. Hanan.
Okay. Can the people who are virtual, can they see my slides? No.
No.
Okay.
We'll check.
And now?
It's starting, Dr. Hanan, okay.
For the invite. So I do apologize for my croaky voice. I'm not sure what's going on there, but it's good on virtual, so I won't be infecting anybody. I think the burden of AMR, as we've heard from our colleague Prof. Tamer, there's more than just 1.3 million deaths attributable per year, and that data came out earlier this year. But we also know that there's at least one child dying every 3 minutes from a multi-drug resistant pathogen from sepsis. We know that 28 million people are going to be probably living in poverty by 2050. And we know that the cost of multi-drug resistant pathogens by 2050 for the extra cost will reach $1 trillion. And there is possibly a 7.5% decline in livestock by 2050. Now, the antimicrobial resistance agenda is a very complex one, and the work had started long time ago, several decades ago, but there has been a more robust movement in 2015 after the first Netherlands Ministerial Conference on AMR, when there was a resolution to produce the 2015 Global Action Plan. In 2016, for the first time at the UN General Assembly, there was a political declaration to establish the IACG, which me and Dame Sally were part of it, and the product of that IACG has also led to significant movement forward for the multi-sectoral work on antimicrobial resistance and other global governance bodies to be established, which I will touch a little bit on a little bit later. But since then, we have been seeing more and more activity on antimicrobial resistance, which I like to call a phenomena. It's not a disease. It's not eradicable. It's a public health urgency that requires work from all sectors, all individuals, and all governments. And that's why I'm quite happy that COP27 has created this event, because I'm pretty sure that Dame Sally will talk a little bit more on the linkages between climate change and AMR. I will try to focus more on the government's, the WHO and the quadripartite work. So I did mention the 2015 Global Action Plan, which we have through the quadripartite, an assessment. I don't want to go into the details of this slide, but I can just show you that the fact that only 17 countries out of 194 have actually a robust established AMR National Action Plan. All other countries are still trying to find their way, and I do admit that it is a very complex endeavor, and it needs to be taken up by the multi-sectoral committee within each of the countries. And I'm happy to see that Egypt is one of the forerunners in trying to find the solutions for this extreme difficult problem. So even though we do have national action plans in over 149 of 21, but I think we have even more, 160 from this year, we still need to work together in the different sectors to make these action plans effective and and efficient in reducing or bending the curve on AMR. When we had over 120 member states through several workshops, asked them and created this word cloud, what are the most daunting or what are the most bottlenecks in making these national action plans on AMR move forward? The biggest issue was funding. Second comes coordination. But there are multiple things that are preventing the national action plans from moving forward. Resources, budget, monitoring, opportunities. So there's so many things that are problematic. So if we want to step back a little bit from the human health, what is One Health? We talk about the One Health response to AMR because the global good we're trying to preserve and make available to the human animal sector is the antibiotics. And antibiotics are used in the animal health, human health environment. And from the climate change, there's some few surprises also that some of the hidden bacteria in the glaciers that are melting away might be giving us some new surprises with new resistant pathogens. So the One Health response is really not just to use it as a trendy word, but it's really for each of the sectors to own and take their responsible part in responding to antimicrobial resistance by using antibiotics cautiously and also providing a hygienic environment so that we do not use antibiotics in replace of hygiene. So very briefly on what have we done with the One Health response, I think the first thing that we had to do is we had to align between WHO, FAO, WHO, which was referred to as OIE before, and UNEP. And we have done exactly that. We've moved forward with the global governance structures, which Global Leaders Group on AMR, which Dame Sally is a prominent figure in that group, and also integrated antimicrobial access, R&D, and regulation. These are the three top priorities that we're trying to work on in our group. This is the launch in 2022 when UNEP joined and we became officially the quadripartite. After that, we were able to identify the major works that is led by the quadripartite joint secretariat. I want to highlight in this slide on the left-hand side, for each of the sectors, we have all four of us joint work that we need to do together. But at the same time, there are sector-specific areas that need to be worked on, and we have created our strategic priorities for WHO, and each of the sectors on their website have their own sector-specific priorities that they need to do to enhance the work on AMR. But the quadripartite joint secretariat has also is helping in promoting AMR, advocacy, political engagement through supporting the Global Leaders Group and the partnership platform that will be coming out soon, coordinate the multi-partner trust fund, coordinate the work plan and mapping gaps and potential opportunities, and coordination and partnership. You can find on our website the quadripartite strategic framework. I won't go into the details of this, but it's a robust document that was done jointly between the four organizations. And this is just a snapshot of the Global Leaders Group and some of the great work that they have produced, and one of them specifically dedicated to climate change. They have their specific KPIs. We have two amazing co-chairs and a very robust group of leaders that work with us, and we work with them at the global level to ensure the voice of AMR. I also want to invite you to the launch of the multi-stakeholder partnership platform that will be hosted at FAO, but still being worked on and supported by the quadripartite joint secretariat. And this is to host at least the largest number of potential stakeholders and partners to share information and to move the AMR agenda forward. And last but not least, again, there's a lot to talk about, but I wanted to focus on the very high level, is that we are also moving forward in next week to the third ministerial conference on antimicrobial resistance. And we're hoping that that conference will actually lead to our high-level meeting in New York in 2024. And hopefully we can finally try to agree on some targets. There's still discussions. It's still in the works, but I think that without having metrics, without without knowing where we're heading with the elements that lead to antimicrobial resistance, and the use in the animal and the human sector are two very important areas. We will not be able to move the needle on AMR. So we're very happy that we will be having the conference in Oman. And with that, I hope that I gave you a very high level impression about what we're doing in antimicrobial resistance. And thank you very much.
Thank you, Professor Hanan Balkhi, for your comprehensive and focused presentation. We really appreciate you are here today. Now we will move with our speakers. With next speaker, Professor Dam Sally Davis. She is the UK Special Envoy on Antimicrobial Resistance, and also she is member of Global Leader on Antimicrobial Resistance. Please, Dr. Sally, join us.
Thank you very much for the invitation to join you. And let me start by commending Egypt for the great work you've been doing, and Professor Tamer for your leadership. Because, you know, time and time again, the alarm bells have been sounding on AMR. AMR is not a new problem, but it's increased because our interconnected global human, animal, and environmental systems are failing and reaching a point of irreversible social, economic, and environmental damage, as my colleague, Dr. Hanan Balkhi, began to talk about. And like COVID-19 and flu, AMR is complicated, not just limited to humans. Our animal health, food chain, and environment are all part of it, all at risk. Everyone here today will, I believe, be in agreement that effective antibiotics are critical infrastructure for health, for food and environment systems. They're essential for farmers to live healthy, productive lives, and for food-producing animals to be treated when they're sick, when people or animals can't access the treatments they need because they don't work or they aren't available. It's a problem for the whole world. And as the global population increases, and with it this global demand for cheap protein, more of our antibiotics are being squandered, not just to treat diseases, which is right and proper, but as a cheaper alternative to good animal husbandry and farm hygiene, and as a way to promote rapid growth for a faster route to market. In turn, these are transmitted into the environment. A marine environment spreads resistant bacteria to places they really shouldn't be. A major new study sampling rivers from across the world found antimicrobial pollutants in surface water in over a quarter of the studied locations, which poses a threat to human and environmental health, with the highest concentration of drugs found in Lahore, then La Paz, and Addis Ababa. Recent research, taking samples from the Galapagos Islands, it's awful, found that giant Galapagos tortoises, which live in contact with human farming and tourism, or those in urbanized zones, have more bacterial resistance to antibiotics than those living in the more isolated ecosystems. The detection of these bacteria in the Galapagos archipelago for the first time turns them into environmental pollutants and the tortoises into potential sentinels or bioindicators of the health of ecosystems. And researchers in Northern Ireland have been looking at how marine plastics might be spreading drug-resistant microbes through our seas and oceans, as if having that plastic pollution floating around isn't bad enough. It looks as if they build biofilms on the plastics, making the problem of drug resistance even worse. So our behaviours are mortgaging the health of the planet, perpetuating inequalities that got us such bad COVID in the first place, alongside a historically unprecedented increase in global poverty. This year, the world's first and most comprehensive estimates of global burden of AMR to date were published, and you saw them mentioned over 1.2 million deaths directly attributed to AMR in 2019 and rising, making bacterial AMR, it's a bigger killer than HIV, TB, or malaria, each of those, and almost 5 million deaths were connected to AMR. This new data has got to be a wake-up call to the world for how and where we must target and tackle infections, just as you are doing in Egypt, how we can redefine our global health and food system's strength, sustainability, and security. With the highest burden of AMR found in sub-Saharan Africa, the most fatal pathogen globally being E. coli, this data has to be a wake-up call for all of us to lead the way to ensure the development of therapies and vaccines, as well as diagnostics, to detect and steer appropriate use. We know national action plans for AMR form the backbone of the multisectoral response, and we've seen where we are. Sadly, not enough financing and not enough implementation. And crucially, we do need to set targets. We in Britain have used our national action plan to target reducing antimicrobial use in humans by 15% by 2024. It's proving difficult. And in food producing animals by 25% between 2016 and 2020. National action plans can drive, as we've seen locally, substantive changes at all levels through collaborative and multisectoral voluntary approach to antibiotic stewardship in livestock production. I'm proud that in Britain, antibiotic sales for animals has halved since 2014. And over the same period, the highest priority critically important antibiotics use has reduced by 72%. More to go. But now the UK is one of the lowest users of antibiotics in agriculture amongst those countries with significant livestock farming industries. And it's all a testament to collaboration in agriculture, with data playing a vital role. The British Poultry Council set up a data collection system. So with that information, over 90% of the industry was involved, and then they could speak from a position of knowledge and deliver their strategies. They reduced by over 90% the use in the poultry. Data's vital. It's vital for comprehensive surveillance system of the food chain, and we are just starting in the UK one of these. Because as my previous speakers have said, surveillance underpins our understanding about interconnectedness of human, animal, and environmental health. Data helps us target our interventions where they can make the most impact. So I'm very proud of our UK Fleming Fund supporting low and middle income countries to collect and share AMR data and join in the WHO GLASS programme. We've got over 22 country grants and fellowships across sub-Saharan Africa, South Asia, Southeast Asia, developing country capacity, enabling countries to develop and own their own surveillance systems. The Fleming Fund is driven by a One Health or integrated health approach with multiple ministries and sectors involved. So in Nigeria, one of our animal health fellows works on food safety at the Department of Veterinary and Pest Control Services. She led the Nigerian delegates to the Intergovernmental Task Force on AMR and uses her knowledge to develop Nigeria's multisectoral national action plan. So governments are beginning to recognise the health security and economic security go hand in hand in AMR as well as COVID. Infectious disease is no longer the sole domain of medics, but it belongs with economists, finance ministries, central and multilateral banks, investors, and insurers. But AMR is also driven by economic problems. The market failure that stymies the bridge from innovative research to patient access and sends small companies developing new products into bankruptcy. And during the G7 presidency, the UK government and then the German government have worked on this with the finance ministers moving forward. And our UK's new antibiotic subscription model awarded contracts to both Pfizer and Shionogi with environmental credentials as one of the key criteria being used. G7 have also made some inroads on addressing supply chain security, which matters to all our countries together. And innovation can't just be limited to human health treatments. We need much more for prevention and preparedness. Our UK Global AMR Innovation Fund is, for instance, co-funding with the International Development Research Centre innovative projects to reduce the use of antibiotics in farming, including nanobubble technology called fish jacuzzis for fish farms in Southeast Asia. So We can look across the world and there are great examples everywhere. And we are already in a stronger position of coordination this year with the formal integration of the UN Environment Programme into the quadripartite, as Dr. Hannan showed us. And the UN Global Leaders Group on AMR, which I sit on, is working to ensure that a One Health and integrated approach underpins any treaty or legal instrument that countries are currently negotiating to bolster global preparedness to the next pandemic, whatever it may be, while we live through the end of the COVID pandemic and the actual antimicrobial resistance pandemic. We need capacity building. We need to promote responsible, sustainable use of antimicrobials. And knowing the risks between health, biodiversity, and animal health are linked, we've got to find solutions that tackle those connections, not work in silos, welcoming the private sector where they can help. COVID-19's been a big flashpoint, but investors were able to do things. And our companies were able, based on previous investments, to produce vaccines and treatments. AMR action matters in the real world, surgeries, in farms, in laboratories, and schools and social media. So we need consumers pressurizing supermarkets and fast food chains. My students here in Cambridge, where I live and work day to day, have been going to annual general meetings of Yum, of Wendy's, of McDonald's to pressure the shareholders to follow suit on AMR. And we must go on working on the One Health spectrum. And so I hope that we will soon see an intergovernmental panel or the Independent Panel on Evidence for Action Against Antimicrobial Resistance, because we all know how the IPCC has helped us move forward on climate change. In fact, their report last summer provided an unequivocal code red for humanity, laying the consequences of our inaction bare. But it doesn't just go for climate change. That's true for AMR. We don't understand where the key vulnerability points and risks are for emerging infections and interactions with the environment as habitat and food source. So we really need an independent panel looking at that. We've got to transform food, health, and environment systems to be more resilient, sustainable, and equitable. And that's one of the strongest opportunities we have to deliver the SDGs. And we know, as we see with other bits of climate change, our behaviours and interventions to mitigate interconnected AMR risks can increase and create value for everyone in terms of productivity, wellness, sustainable systems, and supply chains. So, as you heard, in 2024, all the world's eyes will be on the high-level meeting on AMR at the UN General Assembly in New York, the most important moment on AMR in almost a decade. We've got to seize the opportunity to tackle this silent, insidious pandemic of AMR, build on initiatives like this COP27, the UN Water Conference, and UN Summit of the Future. We need everyone's help. Thank you so much, because we all have a stake in this and all a role. And I look forward to working with you in Egypt and with everyone else. Thank you.
Thank you. Thank you, Dame Sally Davis, for your interesting thoughts and valuable input. Now, we'll move with our next speakers, Dr. Shireen Abdelgawad, the head of the Central Administration of Pharmaceutical Care at Egyptian Drug Authority. Please, Dr. Shireen.
Hello, everybody. I'd like to welcome all speakers, the speakers here and the panelists, and the virtual one who joined us online. Well, Dr. Tamer Hassam has highlighted in his presentation regarding the strategy that is adopted by ADA for combating antimicrobial resistance, which is edasol. So here I'm gonna to just give a brief regarding the efforts that have been conducted by the EDA through this applying of this strategy. Next, please. Okay, the first pillar in the edasol is the ensure access of safe and effective and affordable antimicrobials. And you know here that we have actually registration process and inspection process and so on, that all are aligned with the international standards here. So we are, and also one of the rule of ADA and mission of ADA is to ensure the accessibility and the affordability of these products. So this is always there. Next, please. For the second pillar, which is develop a specialized regulatory framework, it's the Antimicrobial Rational Use Committee. It includes of different stakeholders from different sectors. UPA, the Unified Procurement Agency in Egypt, the MOHP as the main partner, Minister of Health, the Egypt Healthcare Authority, and other practitioners. Next, please. We have actually different publications and protocols and policies that have been released from this committee. We are proud that we have just 1 year and we have released more than 4 publications so far and policies. One regarding to the prophylaxis, surgical prophylaxis, and the other one is for IV to oral shift, and also a monitoring sheet. And still there are some also publications and protocols in the pipeline that will be released by the end of the year, inshallah. Next, please. Then the third pillar, which is adopt and establish laws and regulations. As I mentioned by Dr. Tamer Isam, we do have this pillar important. We have this OTC list that have been released and updated that does not include any systemic antimicrobial, and also we have the formulary that is a very good tool for the healthcare providers that can use the Egyptian one. Next, please. It includes all the specification and the data details regarding the antimicrobial that are there in the Egyptian market, classified according to the WHO classification, reserve and the access one and watch list. And it's very, very, very important and give the healthcare providers with this up-to-date data usually. And then next, please. This is the fourth one, which is surveillance, monitoring, and evaluation. It's very important to have this tool. You know, when you are able to survey the situation here in the country, you are able to analyze, to have this gap analysis and able to get the right decision that they should take regarding tackling this problem. So we, as mentioned by Dr. Tamer Isam, that we have uploaded the AMC on the glass for 2020 and 2021, and it's very important actually. It gives us a picture regarding the consumption there and let us to take some decisions regarding handling this issue. Next, please. We have this point surveillance survey in pilot hospitals that was conducted in collaboration with WHO and MOHP in 2019 and 2021, and I think it's a very good point. Then they have started, we started by these pilot hospitals, and then they will move on and extend these PPS to a huge number that are there to make it. Next, please. Okay, open to collaborate, as mentioned by Dr. Tamer, it's very, very, very important. And I think, as mentioned by Dr. Hanan and Dam Sally, the importance of One Health strategy, and we have to all to cooperate, not only the human sector, but also with the other sectors, the animal and the plant. We are all working together here in the planet. We have to save our lives. So we are open, and we have started some initiatives and collaboration and cooperations with different stakeholders. Next, please. We have a collaboration with MOHP, and also we have a collaboration with the Egypt Healthcare Authority regarding implementation of antimicrobial stewardship in their hospitals. So you can, as a pilot, and then they will extend and expand this experience and experiment in different sectors there. And then also, next please, we have also cooperate with the Minister of Health regarding the HIV also protocol, guidelines and formulary. And this is just examples for the cooperation, but there are a lot of cooperation, not only in the with internal stakeholders, but also with external stakeholders and organizations. Next please. Level up and awareness. Education, this is very, very, very important pillar actually. I think this is one of the most important in all of you, that we have regulations and we have rules, but without having this awareness for the public and the healthcare providers, the appropriate awareness and education, you're not able to achieve your goal, the optimum goal. So it's very important, and we invest a lot in this one regarding for the public, for pharmacy students, and also for healthcare providers. Next, please. One of the main achievements, I think, that it was ADA initiative. It started last year. It's about rational use, and it includes about 39 improvement projects for antimicrobials in different sectors. Actually, this initiative was on 3 stages. The first one is for training. The second, the training for the healthcare providers and pharmacists. We have trained more than 1,200 pharmacists. And then we move to the second level, which is, and second stage is implementation. We have educated the pharmacists there how to analyze the gap there, how to prioritize your problem and to go forward to check and to tackle your problem in your facility. And then the third level is, and the third stage is for implementation. And I think we have a great, I'm very proud about this initiative. We have a great impact actually, and we hopefully to extend and expand the value of this initiative. Please, next. We can see here some of the numbers and figures regarding how average, the increase in the compliance there, the increase of decreasing of the medication error, number of trainees that have been trained by our pharmacists who are enrolled in our initiative, also number of newsletters, committees that have been established, and so on. I'm very proud. Sorry, I talk a lot about this initiative, but I'm very proud about it. And there is also some pharmacoeconomic minimization. Also, there is cost reduction when they apply the projects in their hospitals. Next, please. This is an example for also some publications that we publish on our website regarding antimicrobials targeting healthcare providers that help them to rationalize use and how to form their committee there in their hospitals, the components and so on. I think this is very important, and one of our work there to educate them and to aware them regarding how and the standards for establishing these committees. Next, please. And also, we cannot ignore the public. We have to aware them how this problem is a threat. It's a global threat. We always make these electronic and social media campaigns. We also shared in the WOW Week the previous 2 years, and also we have many activities next week regarding this week. We have lightening the building of EDA. We have make different awareness sessions for students, for public, and for also healthcare providers about the guidelines and the standards for handling antimicrobial. And next, please. Our future plan. This will be our last slide. Please, next. Okay, as I mentioned, we have our initiatives that we will expand and extend the benefits to other stakeholders and other facilities. And also we have these campaigns, social media campaigns, and also not only social media, we also will have this contact physically with other people, with the public. We have also this one regarding the prescription, and we have more control about prescription of the product, and also the vet sector. Vet sector is very important, as we mentioned before, Dr. One Health. We are all working together. We are all in the same planet. And thank you.
Thank you, Dr. Shireen. Really very informative presentation. And now, next, we'll move to our next speaker. We have Dr. Takehiro Nakamura. Dr. Nakamura is the head of the International Environmental Technology Center, United Nations Environment Program. Please, Dr.
Thank you very much for inviting the United Nations Environment Program. I think many of the previous speakers talked about the environmental issues already, and the hygienic environment as well as environmental health. That is also closely linked with the antimicrobial resistance issues. So, next slide, please. What we do in relation to the AMR is only under the One Health, the framework, the working together with the Food and Agriculture Organization of the United Nations, World Health Organization, WHO, and the World Organization for Animal Health. Next slide, please. This year, we published this report, Environmental Dimensions of Antimicrobial Resistance. And our key conclusion is environment plays a key role in the development, spread, and transmission of AMR, and is at one of the One Health response to AMR. Next slide, please. The key findings from this report, we are just really identify the key areas of environmental issues related to the AMR in this report. First issue we identify is the manufacturing of the pharmaceutical issues in the production process. The antibiotics, antimicrobials are released into the environment. There's an on-farm application of the AMR in the intensive crop production as well as animal raising. And we also identified several other the issues. For example, sorry, I cannot see very well. Yeah, the waste from healthcare products that from the health sectors that the antimicrobials are released from the healthcare, particularly healthcare waste may include the AMR, the antibiotics. The poor sanitation and the waste-related issues. We've been working on the wastewater related issues and the waste from the municipal solid waste as well as the household waste, because the people may really try to really throw away the antibiotics into the wastewater and the solid waste systems that will really leak into the environment. And the next one is please, excuse me, can you go back to the previous slide? Oh yeah, that's one. Fecal waste and also animal waste, human and animal waste that will be containing the antimicrobials, and then that will really also leaking into the environmental situation. Of course, AMR related issues, not only those environmental issues, the other confining the factors are also related to this, including that the population growth, urbanization, and climate change, and several other issues are also the compounding factor for the AMR. Next slide, please. There are several the proposed action in those areas in this report. The poor sanitation, sewage, and the waste effluent in the municipalities, effluent from pharmaceutical industry. Next slide, please. Next slide. Use of the antimicrobials and in the nature, manure in the intensive crop production, and also same in the animal production systems. Next slide, please. Okay, this is overall what would be really be done in terms of really addressing this issue from the more environmental perspectives. Of course, assessment and the monitoring of the antimicrobials in the environment is also important issues. Also really the public awareness raising in terms of household waste people not really supposed to really throw away the antimicrobials in the waste systems or wastewater systems. And of course, financing is a very, very important issue. And then we also try to really have a more combined the financing mechanism with the public health sectors, environment sectors, and the food system sectors. Next slide, please. And now we are in the climate change COP. And some of us, including the WHO, UNEP, and the FAO, we really prepare the policy brief on the impacts of the climate change on the human health, animal health, food, plant, and ecosystems, which is also affecting the AMR issues. For example, change in the natural environment due to the climate change. Due to the climate change, some of the vectors distribution is really changing. Wildlife habitats are also changing because of the climate change. That is also affecting the zoonotic diseases as well as some vector distribution. And increasingly, the severe impact of the climate change is happening, and then frequent and the severe extreme event is really happening. For example, after the disaster, the big disasters, the diseases spread very easily, and also this kind of really frequent and the severe natural events due to the climate change will really affect the use of the antimicrobials. And then lastly, and the people are not really taking enough attention to this climate change impact of the AMR, and then further study may be needed, further data should be really needed to really elucidate the relationship between the climate change and the AMR. Next slide, please. And at the same time, I think many of the previous speakers also mentioned there are quite the good global and the regional initiatives that are happening right now. In our United Nations Environment Assembly, we had a resolution on the environment and health. We had a resolution on biodiversity and the health. And in those resolutions, we are calling for action on the AMR. And also African Ministerial Conference on Environment in September this year, they made a specific decision on the environmental solutions to antimicrobial resistance in Africa. So the African ministers of environment are also moving toward addressing this issue. So there's Africa-wide initiatives also happening together with the WHO, FAO, and our colleagues. And finally, our approach is not really addressing only the environment issues. We work together with the WHO, FAO, and the World Organization for Animal Health. We just want to really propose the integrated approach together with other sectors. That's the only solution we can really find in addressing this issue. Next slide, please. Okay, there's a slide about the website location, but I think you can find this report easily on the website. Thank you very much.
Thank you, Dr. Nakamura. It's really an honor to be with us today in our session. Thank you so much. And now we'll move to the second part of our session, which is a panel discussion. Let me inform you that our panel discussion is only 10 minutes long, so please stick to our time. Starting our questions with Dr. Naima Al-Qusayr, the WHO representative in Egypt. First, I'd like to thank you so much. I really appreciate being here today and for your totally and fully support to our team. Thank you, Dr. Naima. My first question will be to you. How WHO In your opinion, how WHO supporting Egypt in combating antimicrobial resistance?
Good morning, Dr. Tamer, if you are hearing me, and Dr. Hanan, congratulations for making today an AMR, but also One Health. Congratulations to Egypt. As WHO, we have historically been working in this area over a decade. However, we are seeing the culmination. And as Dr. Takahiro ended, now we are doing the integrated approach. We are working together. And we are very pleased to say that WHO in Egypt, WHO region headquarters, we really work to bring partnerships around. And we meant it. We walked the talk. Dr. Hanan was here last December, and we revived. Already there were sessions. There were already policy advisory groups, technical policy groups. However, now we are having it much more higher level. This is one. The second thing is that today is the Biodiversity Day. And Biodiversity Day is very much linked that we need to protect the nature. And protecting the nature is said by all the presenters. It's the soil, it's the air we breathe, and we have a beautiful lung sculpture behind us. Is at the same time the interaction between the animal, human lives, the ecosystem, and the planet. So we are very pleased that the One Health and AMR is taking a major impact within this COP27 and placing it. As WHO, we are also working with our partners, FAO, UNDP, UN Environment, other UN agencies, but more importantly, and we thank the Egypt Drug Authority with the leadership of Dr. Tamer to bring the private sector and the civil society academicians and researchers. And I was privileged and honored to be last March with you to see the interaction and positioning the heart. Also, you're innovative to reach to everyone, students, regardless of their background, to be part of the initiatives. And we as WHO were proud to be part of this. The interactive, the integrated approach is the key. I said more than decades ago, because we did make a call then to have an integrated surveillance system. I cannot not speak about the role of the practitioners, be it physicians, the nurses, the pharmacists, the veterinarian, the journalists, to bring the voice, to not to use the improper medication. So that's something is now we are very high, but we need to also speak to the practitioners and bring our code of ethics on doing no harm. And no harm means from all angles, including irrational use of medicines, antibiotics, pesticides for the people who are working in the agriculture. The voice of youth has been very big, and we are very pleased that this is the first time we have the highest representation of the World Health Organization in a COP, climate action of conference of parties, and the youth of the voice have become very strong. So we rely on them to bring the messages, and we rely on them not only to push the AMR regional meeting in Oman, but also the 2024 UN General Assembly and beyond. So we look forward to working with you, assure you there has been so many people behind this. Congratulations to Dr. Tamer for pushing to put this issue at the heart of the COP, at the WHO Pavilion, protecting our breathe air, protecting our climate. And this year is the year of our health, our planet for WHO. I want to acknowledge my colleague who is sitting also virtually, Dr. Elizabeth Taylor. She is the focal point or the responsible for the AMR, and bring the message AMR is one component of One Health, is not all the One Health. However, it's a critical component, because if we do not work on it, we might have, as Lancet February results said, we might have another pandemic. So health security is critical, and AMR is at the heart of the health security. Thank you.
Thank you, Dr. Naima. And so thank you, Dr. Liz, for her effort with us preparing this meeting. And now our second question will be to Professor Hanan Balkhi. Can you hear me?
Yes, I can hear you.
Okay. How can the support that you are providing to countries to address the antimicrobial resistance also strengthen their response to climate change?
Thank you very much. I think it's a two-way street between climate change and antimicrobial resistance. As our colleague from UNEP had mentioned, the climate change impact with floods, tornadoes, displaced populations is going to automatically lead to misuse of antibiotics and decrease in the level of hygiene within the displaced communities and those that are affected by floods, water, and lack of sanitation. So I think that it's really a two-way street. With antimicrobial resistance, the emission of CO2 in the meat production and the need to provide food for the growing global population. Again, as I said, antibiotics are used as a substitute for hygiene. So that is one of the biggest problems. So if we don't understand the complexity of antimicrobial resistance from the environment to the human health sector to the climate, we will continue to be in this circle of increased resistance from different areas, and that's why we are very keen at WHO to solidify the work with the 4 organizations and with as many partners as possible. And I think also putting in mind that an investment within health and hygiene is also beneficial to the antimicrobial resistance agenda. I hope that addresses. Thank you.
Thank you, Professor Balkhi. Thank you for being with us here today. And now, our question to Dr. Takehiro. What are the key interventions and action to address the environmental aspects of antimicrobial resistance that should be part of all countries' antimicrobial resistance response and professionals?
Thank you very much for this question. As I said earlier, that the environmental dimension is part of this really bigger picture of the AMR issues. So we are not really promoting that the environment should do A or B, but we are promoting that the whole package of the AMR has to be addressed through the public health sectors, environment sectors, animal raising sectors, aquaculture, and all the sectors together to really address this. Otherwise, we cannot really pose any solutions to this issue. That's kind of really the message from the environmental sector. Thank you.
Thank you, Dr. Nakamura. And now back into Ida. The question is Dr. Shireen. Could you provide us more information regarding the antimicrobial awareness initiative that you mentioned in your presentation, please?
Okay. As mentioned and announced by Dr. Tamer Aissam, we are proudly and happy for announce that we will start today our new initiative regarding the awareness for the rationalizing of using of antimicrobials. Its slogan is share, apply, and start with us. It's an awareness campaign. We are tackling here 4 levels for the students. For the students in the faculty, youth, doctor, as you mentioned before, this is one of the target pharmacists. This is the tomorrow's pharmacist, and the second one is regarding the healthcare providers in different institutions, and the third group is and stakeholder is for the pharmacists in the community pharmacies. This is the first line that patients usually go and ask them about their health and about the drug and so on here in Egypt. And the last one is with the public. And not only these social media awareness campaigns, but also will meet them in different community places like clubs and so on. This will stand for about 6 months, and hopefully we have these achieve a good outcome from this awareness campaign. As we mentioned, this is one of the most important pillars here, awareness. And thank you.
Thank you, Dr. Shri. Finally, at the end of our session, really I'd like to express my sincere appreciation to be with you today, and really thank you to our panelists and speakers for sharing their time, their ideas, and their valuable insights with us that can really give offers to countries and policymakers to make an idea to combating antimicrobial resistance. Thank you to all, and thank you to our attendees today. Thank you.
Thank you. Have a good day. Bye-bye.
All right, welcome to our online viewers and welcome to everyone here at the Health Pavilion at COP27. We are going to be talking about the role that the ocean plays in our health, and we have a jam-packed session both virtually as well as here in person. So it is with great pleasure that I would like to invite Ms. Maxine Burkett, who is the US Deputy Secretary for the Oceans, who is going to provide us with some opening remarks that will set the scene for what we're going to be discussing today. This event is also a joint event between Land Body Ecologies and the One Ocean Hub.
Thank you so much. Thank you for the invitation to be with you today. It's an exciting lineup. I certainly don't want to get in the way of the powerhouse speakers that you have on the stage today. I do want to bring greetings from the Bureau of Oceans International Environmental and Scientific Affairs at the U.S. Department of State and highlight 3 areas of work where my team is heavily invested in the nexus between health, the ocean, and climate change. The first is coastal community resilience. Whether we're talking about cholera or harmful algal blooms, life-threatening storms, or even underappreciated issues such as mosquito-borne diseases in island states, there's no question that coastal communities are at the front line of climate impacts. We are working, especially through the President's Prepare initiative, on climate adaptation to bolster community resilience in the face of these threats. For example, we're working with partners in several Pacific Island countries to create an islander-led, climate-based early warning system for dengue fever. The second area of work that I'd like to highlight is blue foods. The ocean delivers enormous nutritional value to communities around the world, not just on the coast, but to all of us. And these benefits are delivered not only in the form of caloric content. Globally, fish provide as much animal protein to people as poultry, and more than comes from other forms of meat, but also in the form of healthy diets. My team works to negotiate and maintain mechanisms that make management of international fisheries robust, sustainable, and science-based so that these key life and health supporting resources remain viable. The third is sea level rise and the impact it has on our infrastructure. Sea level rise is one of those issues that has profound impacts on so many sectors that health can sometimes get lost in the conversation. But whether you're talking about water and sanitation systems, or community health centers, or even transit routes that bring patients and staff to the door of the hospital, all of this care infrastructure is at risk amid rising seas. So our Prepare initiative also includes several lines of effort focused on healthcare delivery as well as community-based public health. Moreover, we have a domestic program, Healthcare Climate Pledge, that includes commitments from U.S. healthcare providers to not only reduce greenhouse gas emissions, but also to create resilience plans to support continuous operations. These are the sorts of plans that we need from health sectors all around the world moving forward. So with that, I'll cede the floor to the distinguished speakers, and I very much look forward to the discussion here in Sharm and well beyond. Thank you so much.
Thank you. That was really an excellent introduction, and also the complexity when we talk about the ocean and about the health, and all the different role players and what we need to bring to the table, and also a stark reminder of who are the vulnerable people who are being impacted by climate change. So without further ado, I think it would be important for us to start our schedule and listen to a whole range and host of different speakers who are going to be joining us today. We're going to start with playing a short video on some of the research and biodiscovery research that is undertaken in South Africa. We have a bit of a sound issue. Okay, we still have no sound.
How important that biodiversity is, because the more biodiversity you have, the better your chances are of discovering something new. South Africa, from a marine point of view, is incredibly fortunate. We have a very long coastline of over 3,500 kilometers. And within that coastline, we have a number of bioregions. So these are environments that specifically have very defined habitat.
So Algoa Bay and the regions around it, which are in the Agulhas bioregion, is particularly rich in marine biodiversity, and especially so with the marine organisms on the ocean floor.
The sponges and sea squirts and corals and soft corals, etc. And specifically the bacteria that live with them, so they're microbes. And it's really important that we acknowledge how important that biodiversity is, because the more biodiversity you have, the better your chances are of discovering something new. So to explain the sea to laboratory process, we go out into the field and then we use equipment known as remote operating vehicles, or ROVs. And the ROV has really good camera equipment and video equipment, and we can then use that to identify sponges or sea squirts or organisms that are down there that are potentially of interest for us for research purposes. And then
we use a robotic arm on the ROV so that we can specifically collect the specimens we're interested in a non-destructive way without damaging the reef habitats.
And we also make sure that we're not taking the only specimen that is there. And then we also take samples for a DNA analysis. And the DNA that we isolate is used to potentially identify the genes that the bacterium uses to make that chemistry. We call it gene mining.
We will then use genetic engineering to see whether we can persuade a bacterium that grows in the laboratory, such as Escherichia coli, our gut bacterium, and persuade this bacterium to produce the compounds we're interested in the lab.
And the compounds we have are also screened in our collaborating labs for anti-cancer activity and for potential inhibitory activity against malaria and other parasites. So the compounds that we get from the sea, those don't necessarily end up in the pharmacy, but what they do is they give us ideas about
what kind of compound can be used to target these diseases, so that we can go into the lab and develop these ideas into fully fledged pharmaceutical compounds that can be tested and put into clinical trials.
Hi, I'm Jazz and I'm a PhD student researching natural product development at the University of Plymouth. My main focus is on deep sea sponges and their diverse microbial communities, with the view to discover novel bacterial species with bioactive molecules to solve medical challenges such as antimicrobial resistance. We work alongside the marine biologists. Essentially, they collect and preserve the specimen. We then process the specimen in a way that enables us to access the microbial communities within. We then select bacteria of interest based upon morphology, size, texture, and colour of the colonies that grow on the agar plates. Bacteria can take many forms. Over the past few years, we have seen a rise in bacterial infections that are becoming increasingly difficult to treat. This is due to the bacteria being able to mutate and survive against the antibiotic that would have originally killed them. This bacteria can then pass on the mutation to other bacteria, over time causing the antibiotic to become less effective. Therefore, our role is to find alternative antibiotics to treat these bacterial infections.
Great, thank you. I hope you managed to hear most of that. The sound did go in and out a little bit, but hopefully it was available to you. And it is my pleasure to invite our first online speaker, who's going to talk a bit about One Health in practice, opportunities and challenges. I don't know if she's online at the moment or if we're going to be able to play a video, but I would like to invite Dr. Claire Lajonie, who is from INSERM, and she will be giving a virtual presentation.
Hello everyone, can you see the screen? Is it working?
Hello Claire, yes, we can see the screen, welcome.
Okay, hello everyone, thank you very much. And I will briefly present the interest of the One Health approach in relation to the ocean and climate change. And here, the One Health approach has been used for years in relation to infectious diseases, but gained interest during the pandemic with the creation at the international level of the One Health high-level expert panel, associating the FAO, the International Animal Health Organizations, the WHO and UNEP, to enhance coordination at the international and national level to provide policy-relevant scientific assessment on the emergence of health crises. And the One Health approach is an integrated approach that aims to optimize the health of people, animals, and ecosystems, and to consider their close links and interdependence. So the point is to mobilize multiple sectors, disciplines, communities at different levels of decision making, and to address different issues and mainly take action on climate change and contribute to sustainable development. I had the pleasure to organize a session on One Health and the ocean during the Science Summit last September, and we discussed different topics in relation to health, such as ocean transportation, the need for data in relation to One Health, microplastics, or the Pacific Ocean and the perception of policies towards One Health, or the link with the SDGs, and the main issues beyond the different disciplines. That the main concerns were the issues related to the lack of interlinkages between norms and policies from different sectors, the lack of global standards when it comes to microplastic collection, or lack of consistency regarding the various norms, the need for the best available ocean science observation data and services, and Karina will speak about it, the interest for ocean policies focusing on intersectorality to facilitate the implementation of the One Health approach, and the COVID-19 may be the opportunity to shift from the implicit use of the One Health approach to its explicit use. So there is need to go from science to political action with the joint plan of action published by OLEP and the theory of change. And we can see there are outcomes in the short term, and one of them is to improve One Health governance at all levels, and it's our work as scientists to be involved into that movement. So thank you for your attention. Thank
you so much, Claire. We will move on to our next panelist, which is Pierre Mazega, who will also be providing either an online or a virtual, if he's able to join us online. I'm presenting on his behalf. Oh, thank you, Claire. So I'm staying here. All right, Claire.
I will present our work on One Health and the ocean and policy path to the SDGs. So quickly, we did a previous work on the existing scientific research in relation to One Health with the extraction from the Web of Science of more than 5,000 publications associating 174 disciplines in relation to One Health, and we came with a glossary on One Health with more than 6,000 expressions. And the point is to find the conceptual path connecting One Health, ocean, and SDGs. So we studied 21 policies, international policies in relation to the ocean. From those policies, and I'm sorry I cannot present them, so very briefly, the agenda for sustainable development of the UN General Assembly, or a document from the World Bank on the blue economy, for example. Among those 5 policies mentioning the One Health, the point was to retrieve the path from health to the SDGs, to connect the different concepts on the basis of their occurrence in the text, to extract the path and to see the direct link explicitly given by the text, or the latent indirect path, the latent connection on going from One Health to the SDGs. So I will give an example. Here, for example, the document of the UNESCO, The Science We Need for the Ocean We Want, shows explicitly ocean health in relation to knowledge and to the SDG 14 or to the SDGs in general, while another document from Europe is showing the link between environmental health to climate change and the different SDGs you can see here. But the interest is also the latent path to the SDGs, where ocean health is going through different ways to developing countries, least developed countries, to different SDGs. And here, the main evidences we found is that only, as I said, 5 texts in the corpus mention ocean health. Ocean health is associated with public, human, environmental health, but never associated with animal or wildlife health, which can be an issue. The link to the SDGs is generally made indirectly without any intention, and direct links are only indicated with SDG 14 or with the SDGs as a whole. And in conclusion, I can say that little attention is given to the potential of the interdependencies between One Health, ocean, and the SDGs, and their relation is often purely omitted, while the next step is to better understand those links and to strengthen the dialogue between science and policies, and between the policies and the different institutions to structure a coherent set of actions. Thank you for your attention.
Thank you so much, Claire. Packed quite a lot of information into the short little period that you had available to you, as we have so many speakers. You're going to now have interventions from 3 speakers. We're looking at the different pathways. We're looking at equity, biodiversity conservation, and biodiscovery. Our first speaker will be also, and all of them are virtual, will be Professor Rachel Weinberg, followed by Dr. Jessica Lavelle, and then followed by Professor Matthew Upton, who are working together along these different aspects and components. So I'm going to hand over to Rachel, which I'm hoping is online or is also a virtual presentation that's been presented.
Thanks, Berlina. I'm here. Can you see my presentation?
Not yet. Just hold on. I'm sorry, I can't see the tech stand. Okay, we can see you, Rachel. Welcome.
Okay, thank you very much. So thanks very much for those inputs. And my focus today shifts a bit, although it is related, and it's looking in particular at the ocean genome and its importance, linking to the video we saw earlier. So its importance in understanding the ecological, the economic, and the societal benefits that marine genetic diversity provides, especially in the context of our changing world. Its importance in supporting efforts towards climate change adaptation and mitigation, and in strengthening opportunities for the improved conservation of the ocean genome, and the more sustainable and equitable use of marine genetic resources. And I've got a few short points to make. And the first is that the ocean genome, and here I mean the genetic material that's present in all marine biodiversity, including both the physical genes and the information that they encode, so-called digital sequence information, is the foundation upon which all marine ecosystems and their functionality rest. It also underpins sectors such as fisheries and aquaculture, which collectively form a pillar of global food and health security and human well-being, and its use in research and development, which leads to new medicines, cosmetics, foods, and other products that are important for our well-being. Yet we know that the ocean is severely threatened by overpopulation, by habitat loss and degradation, by mining and associated exploration, pollution, impacts from a changing climate, invasive species, and other pressures, as well as the more cumulative effects of all of those. But there are some important steps that we can take to ensure the conservation of the marine genome. And the first and possibly the most important is to include and recognize the value of marine genetic diversity in marine spatial planning, in sector-specific management plans, in strategic environmental assessments, in climate mitigation and adaptation measures, and other tools. The invisibility of marine genetic diversity, particularly when we get down to the microbial forms, means that this component has been largely neglected to date. And the second is to use opportunities that already exist within my marine biodiscovery research and commercialization. These are obvious, but they often are not applied in practice. So-called access and benefit sharing measures could, for example, require those applying for bioprospecting permits to provide information about how the activity will contribute to the conservation and sustainable use of biodiversity. And this might be through, for example, enhancing the taxonomic knowledge of marine biodiversity, as well as research on the functional biology of the ocean, and ensuring that data is shared and is accessible. And it could also be through capacity development and technology transfer to support the conservation and sustainable use of biodiversity, especially for low and middle income countries and for coastal communities and indigenous peoples. Funders of biodiscovery programs could have conservation as an explicit requirement of the grant, requiring some of these measures to be included. And as an important principle and an overall approach, conservation should be embedded in all benefit sharing agreements and mechanisms. And collectively, these actions could make a small but very important step towards ensuring the conservation and the viability of the ocean genome to continue to support not only humankind, but the more than human world on this planet. I thank you very much for listening.
Thank you so much, Rachel. And I think there are some really important points that you have mentioned in terms of the link to culture, the economies, linked to indigenous people, and also the impacts that we are facing on this. Now going to hand over to Jessica, who is also joining us virtually.
Thanks very much. I'm just going to take a minute to get myself organized. If you would just give me a minute. Sorry, I'm just having some trouble sharing my screen. There we go.
We can see.
Is everyone able to see my screen?
We can see it. Thank you.
Okay, fantastic. Right. So the vision of One Health is of collaboration at local, regional, national and global levels to achieve optimal health outcomes for people and also all other biodiversity we share our ecosystems with. This goes beyond terrestrial environments and also includes the ocean, where the future of planetary and human well-being is dependent upon a thriving ocean genome and environment. However, to protect our oceans requires in-depth knowledge of its biodiversity and also the associated ecological processes, including the impact of climate change. This also holds true for us to be able to unlock the potential benefits of marine biodiversity for biodiscovery and the development of pharmaceuticals, cosmeceuticals, nutraceuticals, and other health products. While the vastness of the ocean does indeed offer innumerable benefits and opportunities, it also presents a lot of challenges for acquiring knowledge and conducting research and innovation. Increasingly, technologies aimed at the collective characterization and quantification of biological molecules using genetic data are being applied to marine biodiscovery and biodiversity conservation. These powerful approaches offer immense potential, not only for discovering novel products for health, but also for ecosystem monitoring and modeling to inform biodiversity management and ocean climate mitigation and adaptation. However, undertaking such research requires extensive sampling of the ocean genome, necessitating access to deep-sea research vessels, specialized underwater technology, and analysis capabilities, all of which come at high cost. Yet there exists a seascape of inequity in ocean science, with uneven participation in research and innovation between high-income and lower and middle-income states. Rich in biodiversity, but with limited research capacity, finance, resources, and intellectual property rights, lower middle-income states are vital custodians of the ocean genome, and their equitable inclusion in ocean science is paramount to enabling One Health. The governance of the ocean therefore requires an approach that centers both the ecological well-being of biodiversity, ocean biodiversity and ecosystems, and also enables transformative capacity building and technology transfer. The Paris Agreement, Convention on Biological Diversity, its 2014 Nagoya Protocol, and also the Convention on the Law of the Sea all offer opportunities to facilitate the co-development of capacity building and technology transfer initiatives based on the self-identified priorities of low and middle income states. By working collaboratively through these agreements, the inclusive, equitable and effective participation of all countries in ocean science will make sure that we have a healthy ocean for a healthy society. Thank you.
Thank you so much for that, Jessica, and it came through nice and loud and clear. And I'll hand over now to Matt Upton, who is next, joining us and looking at antibiotics, antibiotic resistance.
Hello, can you hear me? Can you see my slides?
We can see some slides that says antibiotic and antibiotic resistance on it, Matt.
Okay, great.
Perfect.
Thank you. Great to be here today talking to you. And I don't know if some of you saw the previous session in the Health Pavilion on antibiotic use and AMR. Great background really in a way, but I think it's important for me to state that antibiotics are actually one of the most important medical interventions in the last 100 years. And WHO suggests that their introduction has saved 200 million lives, and they've added 20 years to the average human lifespan. And because we use antibiotics not just to treat infections but to prevent infections, they essentially underpin all of modern medical healthcare. But unfortunately, bacteria are becoming resistant to the action of antibiotics, and this antimicrobial resistance, or AMR, threatens to undermine that medical health system. And our situation is exacerbated by the fact that we've not found any new classes, so these are antibiotics that work in new ways, new classes of antibiotics in the last 30 years. So to address this, we need to find antibiotics of new classes. And to do this, I'm looking at the deep sea. We had a great introduction at the beginning how we do this in the two videos that you saw. But I'll just remind you that Rosie mentioned that sponges and other marine invertebrates are an amazing source of diverse compounds with bioactive properties. There have been 30,000 biomedical bioactive compounds described from marine sources. And this includes 9 current cancer therapeutics that are in clinical use. And it includes compounds with antibacterial, antiviral, and antifungal activity. And it's these compounds at which I see in the work we're doing. And as you saw in the original video, because we can sustainably source these sponges, it means that we're not needing to collect large numbers of them and carry out repeat sampling. So it's a sustainable program of work that we're carrying out with the One Ocean Hub and also with the South African-UK Antibiotic Drug Discovery Hub. The problem I'd like to raise is that sponges grow in what we call gardens, and these are found up to kilometres below the surface of the sea, and the clip gardens have been classified as vulnerable marine ecosystems because their existence is threatened by human activity like deep sea trawling and deep sea mining. And these ancient organisms have a very fragile existence under conditions of cold and immense pressure, and even subtle changes in the surrounding conditions might lead to their rapid extinction. So there's a genuine threat that climate change could lead to changes in temperature or the nature of marine debris arriving at the seafloor, and it's impacts like these that could destroy sponge gardens forever. So that we don't lose access to this potentially unparalleled source of new medicines, I'm proposing that we need to increase awareness of the richness of these environments to help secure their protection whilst maintaining efforts to sample the marine invertebrates and study their bioactive properties. Thank you.
Thank you so much, Matt. Always a pleasure to listen to you, and I hope everyone else enjoyed it from there. We hopefully will have some time for questions as we zoom through our many panelists. And now I think we're going to change pace a little bit with our co-hosts, Land Body Ecologies. And we're going to have our first virtual presentation by Jenny Lighty, who is, and I hope I pronounced that correctly, who's going to talk a little bit about if oceans aren't kept healthy, we won't survive. Can we have Jenny, please? Ah, wonderful. Okay, hopefully it's going to be a single stream. Apologies as we just try and sort out some technical issues. All right, perfect.
My home is in the Arctic and my people is an Arctic people. Our whole existence in the Arctic, our culture, our language and our livelihoods is rooted in winter, cold, ice and snow. Due to climate change, the climate in the Arctic area is getting warmer My home is in the Arctic and my people is an Arctic people. Our whole existence in the Arctic, our culture, our language and our livelihoods is rooted in winter, cold, ice and snow. Due to climate change, the climate in the Arctic area is getting warmer 4 times faster than the global average, which causes melting, vanishing, disappearing, and rapidly changing Arctic world. We do not survive without winter, snow, ice, and snow, and we need all those things to live a good, healthy life. One of our keystone species in the Arctic Ocean is the Atlantic salmon. It is not coming back to our river anymore, to this that low water system. There are many reasons that contribute to the salmon's decline, from warming to Arctic, fast changes in the ocean ecosystems, incompetent exploitation of the world oceans, to loss of biodiversity, as well as bad local ecological governance of the colonial states. The Atlantic salmon is an ecological and cultural keystone species in our traditional territory called Sápmi. our well-being is connected to the well-being of the salmon and the river. I would like to read a poem by Jack Forbes, which inspired us in making this exhibition at the Pavilion. I can use my hands and still live. I can use my legs and still live. I can use my eyes and still live. I can use my hair, eyebrows, nose, arms, and many other things, and I still live. But if I lose the air, I die. If I lose the sun, I die. If I lose the water, I die. If I lose the plants and animals, I die. All of these things are more a part of me, more essential to my every breath. That is my so-called body. And what is my real body? I would like to acknowledge here that the oceans are part of our body. When the oceans are healthy, we too are healthy. When the oceans are sick, we too get sick. Oceans too have to be kept healthy, otherwise we won't survive. Thank you.
Thank you so much. That was really powerful, and also bringing to mind the people who are impacted and affected by climate change, and the deep connection that many have. I'm now going to hand over to our next speaker, Abu Hussein, who's a Gambian fisherman and activist, who is going to also provide his views.
Hello everybody, I greet you all. My name is Abu. I am a fisherman from the Gambia, but now currently living in Spain as an asylum seeker. I am very, very much happy to be part of this program, and also I'm happy to share my ideas about the decreasing of fish in the Gambia. First of all, it all started at the year of 2017 when our new government signed an agreement, like a bilateral relationship with China, to start fishing in our territorial coast and also build fish meal factories. So since the Chinese came and started fishing in our coast, we've been facing so much difficulties and so much decrease of fish, because there is no relax in our sea and there is no control. And so I was against it, because they have these illegal nets that are not supposed to be used, and they used to fish in places that are very much illegal to fish. They will be there fishing, catching fish, and also they introduce very bad nets to our local fishermen to be fishing. And our local fishermen, they were not having any choice, because they also have families to feed. So going for fishing, spending money to buy fuel and food, spending hours in the sea, coming back without any catch, without nothing to give to your family to feed, is something very difficult. So this is what we are facing. So what I am appealing is for help to at least have a control of the fishing and the type of nets that are being used in the ocean, because to be honest, fish is decreasing very much. In the Gambia there is almost nothing, and fishermen are suffering, as well as the locals that used to consume this fish, because the Chinese fish meal factories will take this fish for animal products, like for protein and other stuff, for their livestock and for fertilizers, whilst we, the locals, the Gambian locals, need it to feed. The fish will be exported to their country, and not the Gambian local will benefit from it. So I am appealing to everybody, if there is a solution to this, we really need help. Thank you all.
Thank you, Abu, and thank you for your plea that you have also put forward, I think, to some of the panelists here, and I think we're going to hear a little bit more on this a little bit later soon, going forward, and some of the concepts and guidelines that are there to assist with this. Without further ado, I'm keeping a close eye on the time, and I see it's marching on, and I would like to give others also an opportunity to intervene, is to invite Dr. Edem Mahu, who's also virtually with us, and going to speak a little bit more about some of the other aspects that we need to take into account, for example, ocean plastics, and how this also impacts cumulatively with climate change. Over to you, Edem.
Hello, good morning.
Good morning.
Can you see my screen?
We can see you, we can't see your presentation yet.
Okay, all right. Let me share screen. Are you able to see my screen now, please?
Not yet. I will let you know when we do. We still can't see your screen.
I don't know why it's not showing. I have no idea, but I did share my slides with Senia, so if it can be projected from your end.
All right. We'll just see if we can do it. Yeah, hold on a second.
Not the talk, but the slides, please. Not sure why.
Okay. Unfortunately, we don't seem to have received your slides in time, or haven't got them yet. So if you're able to speak without your slides, please do go ahead. I do apologize.
Okay, all right. So I'll just speak without sharing my
Yes,
slides.
thank you so much.
Okay, thank you very much for the opportunity giving me to talk about other aspects of ocean health, specifically on ocean plastics, exploring its connection to health and climate change. Plastic pollution of the ocean is undoubtedly one of the biggest challenges of our century, of the 21st century. From a macro size to a nano size, plastics have been detected in all ocean basins, including areas that are remote to human influence. To put things in a better perspective, about 30 million tons of plastic leak into the ocean every year, and close to 100,000 marine animals are killed by plastics from various means, either through ingestion or entanglement in the ocean. Now, to produce plastic, we have to use about 17 million barrels of crude oil every year. So clearly, it's not just a health problem, but also there is a link to climate change, which is also linked to health as well. What is the connection with plastics and human health? Currently, 3.2 billion people comprising 40% of the world's population depend on fish for almost 20% of their animal protein intake. Yet the consumption of seafood has been identified as the major exposure routes for plastics into humans when we take away inhalation from the air. Consumption of seafood is a second major exposure route for plastics to get into humans. Plastics have been found in various parts of the human body, including recently in placenta. It's been found in human blood. It's been found in the lungs and humans too. So it means that the plastics that we are introducing into the ocean are not only affecting the animals and the health of the oceans, but also are getting into humans. The additives that are used in plastics, such as the flame retardants, the perfluorinated chemicals, phthalates, bisphenols, and other associated contaminants, are known endocrine disruptors. So when these plastics are getting into human body, we need to be worried, because these endocrine disruptors are linked to various diseases that are really common these days, including diabetes, cardiovascular diseases, childhood and adulthood cancers, as well as reproductive disorders. Studies to clearly link plastics to human health are currently ongoing, but we know that some polymer types in plastics, such as the polystyrene, does have effect on the viability of certain human body cells. And so this has the potential to affect human health. When we talk about plastics and climate change, yes, the production and consumption of plastic and the management of its waste has grave implications for our climate as well. New studies have shown that plastics are responsible for close to 4% of the world's total greenhouse gas emission. That is twice as much carbon emissions than the aviation industry produces, making it therefore a major contributor to global warming. The life cycle of emission of fossil fuel based on plastics can be looked at right from the extraction phase. So during the extraction phase, 61% of the 4% emissions that are coming from plastics are produced or emitted into the environment during the production phase. Then during the manufacturing, when we try to convert these plastics into other products, usable products, we release close to 30% of that 4%. Then the remaining 9% comes as a result of the management process itself, which is mainly through incineration and landfilling. Currently, it's less than 10% of the plastics that are produced are being recycled. And so most of these plastics end up at the landfill sites, and in some areas they are just incinerated. So once we do this, we manage them in this way, we end up releasing these plastics back, or this carbon dioxide and other greenhouse gases in plastics back into the atmosphere, leading to climate change, which in itself has effect on the health of the ocean through ocean acidification, through warming, which is affecting marine organisms and what have you. Thank you very much for the opportunity.
Oh, thank you so much, and I'm sorry we didn't get your slides, but I think you've provided some really important information that often we don't hear about, and that's the actual impact of plastics and microplastics on human health, and getting that research out there is really important. I'd like to invite Dr. Karina von Schuckmann, who will also now just be giving us and talking to us a little bit more about the 2030 Sustainable Development Goals and the role of ocean science. Karina, over to you.
Thank you very much. Can you see my slides?
Yes, we can.
Okay. Thank you very much, and thank you very much for the organization of this very interesting and diverse panel. And I would like to bring a general point in terms of linking ocean science data and services in support of achieving the 2030 Sustainable Development Goals. So I first wanted to leverage again, which has been done today during these different presentations from different angles, on the critical role, the central role of the ocean and the earth system, and also for the achievement of the Sustainable Development Goals. Particularly, the ocean plays a central role in Earth's climate, in particular because of its characteristics like this capacity of taking up large amounts of heat, large amount of carbon, helping to mitigate effects of climate change, but also with a huge amount of characteristics to transport these substances like heat, carbon, and other substances over large distances around the world, and also in the deeper layers of the ocean again, in order to support of mitigating the impact from climate change. So the ocean is also represented here at the center of sustainable development for the three pillars of sustainable development: the environment, society, and economy, with the major message that the ocean offers opportunities to face causes and consequences of climate change globally and locally, and calling for a dramatic scaling up of efforts towards ambitious mitigation and adaptation. So this is again represented here in a different manner in terms of its central role for sustainable development, with putting the SDG dedicated to the ocean, SDG 14, at the center of the entire SDG Sustainable Development Goal framework. So again, the ocean offers opportunities to face causes and consequences of climate change at different scales, and the recommendation which had been here formulated in collaboration with a transdisciplinary team in this publication is that there's a holistic approach that embraces sustainable ocean stewardship informed by science, data, and services to support society and the economy is required to create the future we want, which is the last part, the leitmotif of the UN Ocean Decade for Sustainable Development. This is a representation of the so-called added value chain, again of filling up between the environmental pillar, societal pillar, and the economic pillar for sustainable development. And this added value chain is the core of ocean and climate services that connects raw products and oceanographic service knowledge to high-quality data products and indicators, which can then be used in order to communicate across the different interfaces and between the different pillars of sustainable development. So these added value products can provide the evidence basis for agencies and reporting bodies, decision makers, other stakeholders, and the public, yielding societal and economic benefit. So we have the opportunity to take action to protect the ocean and improve the delivery of ocean information with end-to-end products developed specifically to inform ocean stewardship, policy, and ocean governance. Thank you very much.
Thank you so much, Corinne. That was really succinct and showing those connections really clearly. I'm going to now invite in-person speaker, yay, someone who could join me here on the stage, so I'm not sitting here all by myself, is Mr. Rubari, who's from the FAO, and I think we'll be able to also respond a little bit to some of Abu's comments that came across. Over to you, Taro.
Thank you. Hello everyone, I don't know if you can hear me, but Abu is left now.
Okay, maybe you can stay a few minutes. I think some elements of response will be of interest to you.
Yeah, because there are also some things that I really have in mind that to share.
Sorry, Abu, if you can just maybe hold on and we can just give some space to Tara to just have a conversation, and if you could just hear what she has to say, it might be interesting for you. Thank you. Just hold on a second. Thank you.
Okay.
Yeah, so thanks for the floor. So I had a beautiful speech prepared, but I think I have to react to some of the things that I have heard from the previous speakers. Probably because also it makes it more lively for the public who is sitting here, and thanks for staying for until the end. So I'm Taru Bahri from the Fisheries and Aquaculture Division of FAO, and I was invited here to speak about FAO promoting One Health approach as part of agri-food system transformation. But I think that I have to react to two things, and then I'll provide the elements that I had prepared about the fish meal, because this is really a critical question, because fish is critically important for human health and for nutrition, because it includes a lot of nutrients such as zinc, vitamin A, vitamin B12, omega-3 and so on, and it is recognized that it is important for human growth and for the human health, basically. And what is happening, as the fisherman from Gambia was saying, is that in many parts of West Africa, this fish is now transformed into fish meal, which is like a flour that is used basically to feed other animals, which is, you know, a nonsense. So together with the world fish, we have undertaken a study to assess the impact of this of the fish meal industry in West Africa. So both in marine fisheries and inland fisheries, so lakes and rivers and so on. And this study is going to be presented. And I was saying this study is going to be presented early December at the Fisheries Commission that covers West Africa, and with the purpose of alerting or raising awareness of the scientific commission that informs that Fisheries Commission, and get some policy advice on how to tackle this. And I think there's some signs of hope, because we hear a lot of negative messages and, you know, alarming situations. But there are some countries that have already started reacting on this question and have developed some management plans for what we call the small pelagic fish. So these are the fish that are used to produce this fish meal. And are starting to forbid the use of the small pelagic fish to produce the fish meal. So I think that it's a process, because what he raised also is the question of the illegal fishing. And there again, there are some international instruments, and for example, in FAO, there is the only legally binding instrument, meaning that once the countries have ratified it and signed it, it is an obligation from international law to apply it, which is the Post-State Measures Agreement, which is one of the instruments to fight against illegal fishing that forbids basically a country to land its catch when it is illegally caught. So of course there's still a lot of work that needs to be done, but I think that the instruments are being developed and that we're making progress. So I don't know if I have exhausted my speaking time, or if you want me to. Okay. Then on the plastic, there's something also that I wanted to say on the plastic. So the plastic is an important question, of course. So, but it has to be put in a global perspective of, you know, plastic use and plastic production, because it is true that it has been widely said that seafood is the first source of microplastic intake for humans. But this data are currently questioned, because we have found plastic in beer, in salt, in air that, you know, we are breathing, and beyond the microplastics, now the big challenge are the nanoplastics, and this is extremely difficult to study, because when you enter in a laboratory to study nanoplastics, you have already contaminated, you know, the laboratory. So it's extremely difficult to understand. And nanoplastics are everywhere, as in the, you know, on this table, and, you know, on the paints that have been used for this pavilion. So it is a critical question. And I would invite you to consult the FAO report on microplastics in fisheries and aquaculture. where there is a risk assessment that has been done with the data that were available at that time in 2017, and that basically conclude that given the amount and using extremely high amounts of microplastic, the highest amount possible of microplastic in fish, it concludes that it is more dangerous for your health not to eat fish than eat fish with microplastics. Also because there's an important element that we need to be aware of is that when fish ingest microplastic, it gets in their guts, right? And usually we don't eat the guts of fish. You know, we eviscerate the fish before consuming it. So except for crustaceans like shrimp, or when you eat small fish, small fried fish, you eat it whole. So this is where you ingest microplastic. Or when you eat oysters or mussels, this is when you actually ingest microplastics. Anyway, so I just wanted to give some nuance to this narrative, because it's extremely complex, without minimizing the importance of acting on this question. And then another thing I wanted to say about this is that there is this whole I think global action on plastic removal from oceans, and when it comes to fisheries and aquaculture, there is FAO is engaged in a global study on assessing the sea-based sources of plastic, because fisheries and aquaculture have been accused of being the main source of plastics at sea, and we're looking into that, knowing that there are also technical guidelines on the abandoned and lost fishing gears, which are recognized to be an important source of plastic pollution in the ocean. Then I think that to maybe close, I would just go back to what I had prepared, because there are some elements that I would like to highlight in there. So when it comes to food safety and biosecurity, they are recognized as important sustainability challenges in fisheries and aquaculture. So I'm happy to point you to the work that my colleagues are doing, for example, on harmful algal blooms that are expected to be, to increase in the context of climate change, because we're in COP, so we talk about climate change, and also on antimicrobial resistance, but I think this has been mentioned by another speaker. Then something that I wanted to say, going back to nutrition and human health, is that fish is a vital source of essential nutrients, as I was saying earlier, and it is good to note that the human consumption of fish has been increasing steadily between over the last decades. So going from 10 kilos per person and per year in the 60s up to 20 kilos, we're around 20 kilos now. But it has actually a wide range of variability, because in some areas of the world the consumption eventually is zero, whereas in other areas it's 100 kilos per person, for example in some islands in the Pacific. Half of the countries that have public health policies identify fish consumption as a priority, which is, which could be improved given the importance of fish for human health. But we all know, and we all hear that fisheries resources are under a lot of pressure. That 1/3 of fisheries resources in the world are overexploited. But there is a very interesting figure, is that when you fish and process the fish, you actually discard 30 to 70% of it. Whereas, for example, the bones and the skin these are the most nutritious part of the fish. It's not the flesh, it's all the things that you throw away, which is quite interesting, isn't it? And we have done some experiments with the colleagues who deal with nutrition to develop some some nutrition and low cost food products that you could use in school feeding programs or for young children or pregnant women or this kind of things. So there again, it's also a matter of how we use our resources, especially in this context of climate change, where fisheries resources are going to be under increasing pressure. So we really need to use them better. And then I think that part of this mission impossible of talking in 3 minutes about health, climate change, fisheries, and nutrition and biodiversity. I just wanted to flag that the aquatic food sector exploits almost 3,000 species in capture fisheries and farm over 650 species. This is quite unique in food systems. I don't think there is any food system that reaches this level of biodiversity. But of course, there is a growing pressure on this biodiversity in aquatic systems, and if nothing is done, I think there is a UNESCO estimate that suggests that if nothing is done by 2100, we will have a loss of 50% of this biodiversity. So I think it's really important that we do something about it. And then just to close, because I think I went way over time, I'll just point you to this QR cards that I brought here on blue transformation, which is the new approach that FAO is advocating on improving fisheries management, developing sustainable aquaculture, and improving the efficiency of value chains to minimize waste and use the fish better. Thanks for your attention.
Thank you, Tarab, and it's also good to see it within a systems approach and how it all fits and feeds together. Last but not least, we have our final speaker, and I'm really trying, but we're running out of time, that we will have some questions, but sorry, I don't think we will. But Catalina Pizarro will be presenting and talking a little bit about the Global Treaty on Plastic Pollution. So we're back to plastic again. Over to you, Catalina.
Thank you. Can you confirm that you can hear me?
We can hear you.
Okay, thank you. Well, as the previous speakers have mentioned, the science environmental health. For example, plastic pollution is lethal for many species, but it can also alter the overall carbon cycling. And throughout its life cycle, plastic also contributes to climate change. Currently, there is no global binding agreement with specific and measurable targets to address plastic pollution. However, there are at least 10 multilateral environmental agreements and 15 regional instruments relevant to marine pollution and hazardous waste. The current system, however, has some gaps. The approach remains fragmented, and there is no single legal instrument that specifically has as its primary goal the elimination of marine plastic litter and microplastics. An international legal instrument with a governance structure and clear mandate could provide opportunities for a cohesive and targeted approach to reducing and eliminating the negative impact of marine plastic waste. And in response to growing concerns on the impacts of plastic pollution on human health and environment, over the years, the United Nations Environment Assembly, best known as UNEA, has passed a number of resolutions on how to address plastic pollution, always with a focus on the marine environment. However, UNEA Resolution 5/14 has been called the most important international multilateral environmental deal since the Paris Agreement. The resolution is entitled End Plastic Pollution Towards an International Legally Binding Instrument, and calls for the development of a legally binding instrument on plastic pollution, including in the marine environment. Addressing the full life cycle of plastic, the resolution requested the Executive Director of UNEP to convene an Intergovernmental Negotiating Committee, or INC, to commence its work during the second half of this year, with the ambition of finishing its work by the end of 2024. Substantive aspects of the negotiation are defined in the resolution in paragraphs 3 and 4. The treaty could include both binding and voluntary approaches, which nevertheless does not interfere with the nature of the instrument. which will be a treaty and therefore binding on parties. The instrument should be based on a comprehensive approach that addresses the full life cycle of plastic, taking into account, among other things, the principles of the Rio Declaration, as well as national circumstances and capabilities, including provisions to promote sustainable production and consumption of plastics, circular economy approaches, to promote national and international cooperative measures to reduce plastic pollution in the marine environment, including, importantly, existing pollution, national reporting, periodical assessment of progress, and scientific and socioeconomic assessments related to plastic pollution, compliance, among other relevant provisions. Thank you. Making it very short this time.
Thank you. Yes, I think it's very difficult to put a whole treaty into a few little sentences in 3 minutes. Unfortunately, we are run out of time. It's 12:45 now when the session's supposed to end. I would really have loved to have heard some more from our online speakers, but thank you very much for your presentations and for your time, and also thank you very much to the viewers who have listened to us. I'm really sorry that we can't give anyone some more time, but I think just some central parting words is ocean is central to our health, and as we sit here in the lungs in the health pavilion within this beautiful structure that's within here, is realizing that every breath we breathe also is contributed to our oceans, and they say at least 50% of the oxygen is produced by the oceans. We also know the ocean is actually impacted quite negatively, which is going to have an impact on our food systems. And we've also heard how the SDGs and the role of the ocean in achieving the SDGs is really important, including health and well-being, as well as for poverty alleviation through the many of the food systems that are in place. So, and we've also learned how the ocean could have some of those particular solutions through biodiscovery and some of the microbes that can provide us with what we need for to help us with some of the health issues. So again, thank you so much for your time. Thank you to Land Body Ecologies for partnering with us on this event. I'm sorry we don't have time to give everyone a space to introduce themselves. Have a very good rest of COP27. Thank you.
Wow.
Thank you.
1, 2, test 1, 2.
Hello, everyone. Welcome to this beautiful health pavilion where we will be discussing nature-based climate solutions for human health on this Biodiversity Day. So it really is the perfect place to be, because you see this beautiful sculpture that we have behind us is actually a perfect example of how interconnected the environment, climate, and human health are. And I think Maria will say a few words about this in a moment. So I am here to welcome you. And I would like to invite our Director of Environment, Climate, and Health, Dr. Maria Neira, who in this pavilion and in many other parts of the COP really needs no introduction. So without further ado, Maria.
Thank you, Christina. Thank you very much. Welcome, everyone. I see a lot of enthusiasm. How are you today? Good. As Christina mentioned, this sculpture has an incredible meaning. I hope everybody got it. We wanted to make sure that we were bringing health at the center of the climate change, because we are hoping that human health will be the kind of strong motivation to accelerate this agenda and really tackle the causes of climate change. But in addition to that, the great connection to the biodiversity. Stuart, thanks for being with us. Deputy Director General of the IUCN. So thank you very much. We will try to have a conversation here. Why biodiversity and health? I think we don't need to demonstrate or to prove the very strong connections between human health and biodiversity. Will any one of you disagree that if we keep deforesting, we will have an increase on zoonotic diseases? I don't need to prove you or to demonstrate that if we keep polluting and destroying our ecosystems, health will be very much affected. I don't think I need to prove anymore that more we destroy the biodiversity, more we are opening the doors for potential emergence of new virus. So for all of those reasons, definitely biodiversity and human health, we are together on this battle. More you protect the biodiversity, more benefits we will be obtaining for health and for human health. When we talk about nature-based solutions, you need to explain people what that means. But let me translate what it means for me as a public health officer. Nature-based solutions for me are basic public health interventions. Nothing else. Whatever you do to provide solutions to protect nature, somehow, even if you don't know it, at IUNC, you are contributing to human health. You are as well participants and contributing to public health. But of course, don't take it for granted. We need to select and prioritize those nature-based solutions that will contribute the most possible to human health. And I think demonstrating that, proving to our citizens, to the international community, the benefits that you are generating to human health by or putting in place those nature-based solutions, the better for all of us, because it generates a positive engagement, and human health definitely generates a lot of motivation. And I'm very pleased to announce that it was just 1 hour ago, Christina, 1 hour ago, the COP27 presidency has launched the ENACT, I think it's a very nice acronym, for nature-based solutions. And it provides all the stakeholders and actors with a platform to advance with that. And of course, WHO is very pleased. We will be leading the health stream. Obviously, we cannot lead another one. This is the one on which we have some experience and knowledge. And we will be very, very, very happy to join forces and make sure that those nature-based solutions, as I mentioned, there are the best possible public health interventions generating the maximum possible health benefits for all of us. So with all of that, Stewart McGuinness, the Deputy Director General of the IUCN, I'm sure that he will tell us much more about this presidency initiative that has just been put in place. Over to you, Stewart. Thank you very much.
Thank you very much, Maria. So it's a real pleasure to be here, and I'd really like to thank WHO for organising this. I think this is a timely event. In fact, I just want to acknowledge we've been working on this, we've been building up to this for a couple of years. We had a very good event at the World Conservation Congress in September last year with a real focus on health and biodiversity. But I think there's a lot more. Oh, okay, thank you. I think there's a lot more work we can actually do. Now, very quickly, just in case some of you don't know who IUCN is, we are a union. We got 1,400 members, about 90 states, about 150 government agencies, protected areas, water authorities, forest authorities. Indigenous people are another category. We've got a standalone category for Indigenous peoples organisations. We've recently just brought in subnational jurisdictions, cities, municipalities, provinces as a new category. And then we've got civil society, NGOs. So we've got 5 categories really going from states to Indigenous peoples, to civil society. We don't have the private sector as a category, but we actually do work and collaborate with them in different partnerships. And we've been around for 70 years. Our business is working with, like you, health professionals, working with complex systems, in this case ecosystems. And we've been putting in place, bringing around and bringing the conservation community around on several items, and I'll just mention a couple of those. We've really driven the expansion of protected area network. Then we realized that there were actually some major social justice issues that needed to be addressed with. So for the last decade or longer, we've been really working to ensure that protected areas are underpinned by a very strong rights-based approach, recognizing some of the mistakes that have been made in the past, looking at finding ways to actually recognize and bring redress to that, but at the same stage making sure that we're finding ways of protecting and conserving spaces that enjoy societal legitimacy and actually really act as a contribution to preserving biodiversity, but a range of other societal goods and services. We've also, like many of you, we're a science-based organisation. We've got a network of 18,000 scientists. Many of you will probably know you can see it here on my lapel, the Red List of Threatened Species. It's one of our signature products. We have assessed 7% of all described species across the world. We're working to expand that, but we then reassess those, and that gives us a sense of just where the risk of extinction, not only the risk of extinction of individual species, but also the broader where trends are going with conservation. We've laid the groundwork for several of the important environmental conventions. And I think the other thing is we've more broadly really tried to locate ourselves in the global agenda for sustainable development. And as we do that, really helping to redefine issues between communities, citizens, and nature. And just as a small example, a relevant example I'll give is we held a fantastic meeting in Kigali in July around, it was African protected areas. Really quite radical. We had lots of discussions around decolonizing protected areas and protected areas legacy. But the interesting issue that came in, there was a very strong theme running through that on One Health. and actually how we actually start to look at issues around environmental management, protection, etc. And we had a strong representation from several African health ministries there. Now, we're talking about nature-based solutions, and I want to build on this point and the point of dealing with complex systems. Nature-based solutions is an integrated framework. It seeks to integrate. And I think for far too long we've been working in our own silos. I would definitely say, when I look at it from an environmental perspective, that singular, sectoral type approach has not only stopped us realizing some opportunities, it's created some problems. So, for example, maximizing agricultural production, but forgetting about the nutrition element of that, forgetting about the environmental element of that. We forget about trade-offs. When we work in an integrative way, we're forced to confront trade-offs, and we're forced to deal with them and recognize them and work on how we're going to balance it. And that's what nature-based solutions does. It is designed to address a range of societal challenges, from climate change to food security to including human health. And not only, there's been a lot of focus with the COVID pandemic, there's been a lot of focus about the issue of pandemic prevention and the transmission of zoonotic diseases. Now, that's important, but it's not the only bit, because I think we want to look at health from the perspective of water security and air quality. We want to look at health from helping to put in place healthy and sustainable food systems, and ones that really deal with the nutritional side as well as just the calorific side. We want to look at being able to help communities become more resilient in their approach to health in the face of climate change through how they manage their environment and ecosystem. And that's not just in the rural or coastal areas. It's in urban areas as well. We've been working. The government of Rwanda has now started to put in place protected areas in the city, restoring wetlands that actually, instead of actually having these wastelands that are breed disease, wetlands that is designed for recreation, but critically also for flooding control as well. And some I could talk on about that, but I know I'm under the gun for time. So I think that's what we really want to bring with nature-based solutions. And we do fundamentally believe that nature-based solutions, it's not just about climate adaptation, it's not just about climate mitigation. There is a fundamental role on health. To do that, though, I've mentioned about integrative frameworks. But we also then need, for integrative frameworks, it means you need to bring partners together. You need to have radical partnerships. We need to be getting out of our boxes and really exploring, having those conversations. And that's one thing that I really hope that we will be doing now, is actually bringing these together to start to work with different communities. We have as much to learn. And not just in the immediate issues, but also how you approach problem solving as a health community. There's a lot we can learn as a conservation community as well. Now, in conclusion, it's always dangerous to ask an Irishman to open a session, because I can talk on and on, especially on a subject I enjoy. But as Maria said, an hour ago, we launched, with the Egyptian presidency, we launched ENACT, Enabling Nature-Based Solutions to Accelerate Climate Transformation. That's what it is. It is a partnership, an informal partnership, but associated with this COP for both state and non-state actors. We have, it is implementation focused. It is also actually making sure that we are clear about what is nature-based solutions. And this is one point I want to raise for you. Some of you may have heard in the past, there's been these deals on forests that displace communities or whatnot. Those aren't nature-based solutions. We have got a robust framework, 8 criteria, a set of indicators there that actually say, if you're not recognizing the trade-offs between, let's say, food systems and sequestering carbon, and you're making those trade-offs so you're disadvantaging food productivity, it's not a nature-based solution. Call it something else. Call it a land grab. Call it, I'll be polite, but it's not a nature-based solution. I think we've got a real strong framework now to really work this forward. And what I'm really excited about, and why I really wanted to join Maria here, is because I think health is absolutely central to this. I think with the ENACT partnership, we will be reporting back in Abu Dhabi in 12 months' time on a report. We're committed to do that, and health will be one of the chapters on where we're seeing nature-based solutions making that contribution to health. So I'll just conclude with saying nature-based solutions, it's integrative, it needs radical partnerships, it's got high integrity, and I really look forward to working with all of you as we start to really make those links about health in the broadest sense and how it really focuses with a nature-based solution. By the way, sorry, one thing I actually should say as well, I mentioned a range of health options. The other thing that I think we realise it's really important with the nature-based solutions link is mental health as well. So that's where we will want to work with you, and we'll want your guidance to help us move forward on that. Many, many thanks.
Amazing. Big thanks to Maria and to Stuart for those very inspiring words. I think this is a great kickoff to this important dialogue and event. A couple of things that really struck me was how Maria was saying, nature-based solutions are not only ways to mitigate and adapt to climate change or to conserve biodiversity, they are basic public health measures. And that is why we are here today, to think about how it meaningfully contributes to our health. Some things that struck me, everything struck me because everything was important and in what both speakers have said. But I really appreciated the way Stuart emphasized the need for cross-sectoral and inclusive collaboration and partnerships for nature-based solutions. And I think that the new partnership between WHO and the IUCN, which was established through the Expert Working Group on Biodiversity, Climate, One Health, and Nature-Based Solutions, really seeks to do just that. And one of the very exciting developments is that this dialogue that is starting here today doesn't end here today. This will feed into some key messages that will be launched at the 15th Conference of the Parties to the Convention on Biological Diversity next month, and to a broader report on nature-based solutions for health, which is going to be launched at the very start of 2023. So we need everyone in this room and outside of it to engage, to share their experiences, to share their case studies, and to tell us why this matters to health. And we need health sector leadership as well. Nature-based solutions can't only be driven by the climate and the conservation communities. So without further ado, we've got terrific examples of how this is being operationalized on the ground, some of which we're very excited to share with you today. I would like to precede this by saying we've also had some initial consultations for this report, so the dialogue that's going to be held here is going to inform some of those key messages, but we've also had prior consultations with different groups, including youth. We can't do anything without youth leading the charge, so we have had an initial intergenerational dialogue with youth on this very topic. And we have also had the honor of having a broad consultation with Indigenous communities on the role of Indigenous knowledge in community health and how that ties in to inclusive nature-based solutions. So I would like to invite our wonderful group of panelists to come and join us here on the stage. beginning with Ryan from Youth for Nature. I think we'll bring everyone up at the same time. Jessica, who is the co-chair of the UN Global Indigenous Caucus and the Network of Indigenous Youth in Latin America and the Caribbean. Jessica, bienvenida entre nosotros. Jonathan, whom we have the pleasure of connecting with online, and he is the Executive Director of Health in Harmony. Do we see, there he is. Hello, Jonathan, we see you. We hope you can hear us and are very much looking forward to hearing of your experience. Carol, who is the lead of the MSF Humanitarian Action on Climate and Environment, and of course, last but certainly not least, Charia Wanus from the World Organization for Animal Health. So grateful to have each and every one of you here to share your experiences, some of the challenges, especially some of the opportunities to really scale up nature-based solutions in a much more inclusive and cross-sectoral way. So let's start with youth voices, given the importance of youth. Ryan, you know, what you've done so much at the Nexus with nature, on nature-based solutions, and you've even gone through very extensive consultations with a large network of youth to develop the Global Youth Position Statement on Nature-Based Solutions. Could you share some of the salient points of that with us?
Thank you, Christina. Thank you, everyone, for being here today. Youth for Nature has worked with the Global Youth Biodiversity Network and Yongo together to publish the first ever nature-based solutions position statement. So this is what over 1,000 young people around the world think is nature-based solutions. Why did we work on this? It also includes over 117 countries. We worked on this because as the IUCN was speaking that some of nature-based solutions are always used as co-option or land grabbing, or they don't include social justice within their measures, especially by fossil fuel companies as well, trying to plant or do restoration in some part of the world, but they're also continue on emitting fossil fuels and carbon dioxide into the atmospheres. So this consultation was rooted in social justice, and it was rooted in ecosystem-based practices. So hence why we've used the definition used by the IUCN in specific to co-lead this position statement. Now, the position statement is more of a political narrative. It's more of what young people think is nature-based solutions and what is not okay for young people to be considered as nature-based solutions, especially the co-option and land grabbing and the social justice part of it. And this was the first ever published MBS Youth Position Statement. It does not include specific categories regarding human health, which we do want to follow up. That was the first ever time we do it. And it was about the political propaganda of what nature-based solutions are. But I think moving forward, we do want to include the human health aspect into nature-based solutions. What do young people think about that? What is important for them for their own health? Because it's fascinating on the negative side that human health regarding climate change is either we all die or it's all good. Not taking into account that our lungs, our mental health are all gradually affected by the effects of climate change, and nature-based solutions are a viable option to counter that. Hence why we'll probably be launching another consultation throughout the next year to see what do young people think about nature-based solutions when it comes to their own health. So yeah, I'll just stop there.
Fantastic, Ryan. I think that you've given us a wonderful overview of that youth position statement and some of the entry points for health. Do you have any further thoughts on how we can scale these up, in how we can further engage with other youth working in the health community, for instance?
Yeah, obviously, like the first target group would be either young people proven by public health experts that have suffered in their health due to climate change. Those would be the first people. Like the second category or the second target would be young people working in the public health sector, being able to bridge between human health and nature-based solutions. Exactly what you do, but that would be a young person as well, bringing their own perspective. So those would be the first target audience for us, and then we'll move forward from there.
Brilliant. Thank you so much for those initial words of wisdom, Ryan. And now I will turn to Jessica. Jessica, Ryan was talking about the position statement of youth. You also very much represent youth. You represent the Global Indigenous Forum, so a particular segment of youth. And Ryan was talking about issues such as land grabbing and co-option and social justice. These must very much resonate with you as well. So I would like for you to share with us what some of the key challenges that you faced, but also as an Indigenous youth, but also you've done terrific work with WHO, with the Pan American Health Organization, to raise the profile of this more holistic vision of nature and health. So could you share some of the insights that you've gleaned from that?
Thank you. Duba di Quindo está ahí. From my different process, I want to say thank you for inviting me for staying also here, because I have the different challenge, like you said, also in the face for indigenous people. Now I am just part of the ex chairs, like the advisor and the Global Indigenous Youth Caucus, but when the be part of this process, I want to try to learn and to try to open the doors with other youth people. And then to close at me, stay my brother, other people, the younger people, to try to also working together for open spaces on the Take the Bus, a specific bus for indigenous youth. Because I want to try to start in the remaining today and this day biodiversity or the COP7, to try to also to say that this day for us is really important, because needed work together for solution, helping for preserving the humanity. This is not only for indigenous youth, it is also for non-indigenous youth, it's for the humanity people. And then this is the one thing is the vision holistic. And then now I have the see alone effects for the climate change, but that these problems is not disconnecting with other possibility solutions, because when the talk about the effects for the climate change, also talk about the human rights. Also, I needed recognizing the sorry. Also, it's necessary to recognizing that when the people lost one part of the rivers or the biodiversity, even on the blocks or the ice, when the people lost this part, also lost part of the history, lost part of the identity. This is the one happened for indigenous youth and the communities. And these effects have the progress and they have impacts for the new generation. Whether this is the also impact in the new diseases, I don't know what it is says, but like the diseases, because I already had the malnutrition, cancer, diabetes, and other new like the COVID pandemic. But these effects is not only the health, also have the effects in the mental health, because the indigenous youth can not about more than the other particular activities in the communities, like they learn, for example, to swimming, or learn how to fishing, or learn the other activities in the communities. And this is the one happen in the communities, but they also is the future generation will be suffering more like this generation. The climate change not also have connection with problems, also have connection with solution. This is the one thing important, because now needed to work for to try to make a solution, back solutions, and to try to have the connection when the perspective is holistic. Is the knowledge for indigenous people is to try to also protect the Mother Earth. The indigenous people is part of the medicine. The indigenous youth is also medicine for the future generation. This is the one thing that I am to say happy for to try to connection also when youth know indigenous, because they be part of the dissolution, and to work together is the one way for to preserve it to the humanity. And then this inform is the one the first state for to continue to working together even when the other UN agencies, and to try to connecting these proposals and have impacts in community levels, national levels, and to try to not be only promise. Is also to try to take actions, but also base solution for the future generation. This is the one thing the indigenous youth to try to take the boss, even when they have a lot of barriers. It's not too easy broken, but we need to try to broken for the preserve this traditional knowledge and the conserve all the humanity. Thank you so much.
Thank you so much, Jessica, for sharing that very compelling account, talking about the different interlinkages and how it affects how the degradation of nature, how climate change is all one, and how it affects your biocultural identity, how it permeates the mental health outcomes, how there are impacts for non-communicable diseases, whether it be diabetes or malnutrition. So it really does permeate every aspect of Indigenous health and well-being. And it also has impacts not only on your generation as youth, on existing older generations, but it's also a question of intergenerational equity. So thank you very much for sharing that holistic perspective. And if you will, Jessica, I would like to invite you to also, because you've done so much great work also with the WHO at this intersection, can you share one or two examples of some of that work, what that work is?
Thank you. Thank you also for the question. That I wish also to try to connection when the UN agencies and when the groups for the social CBT foundation, everything, and the government to try to connection this solution. And the one thing that already have it part of the commitment when the World Health in the organization, and have two younger people in this committee for to try to improve and give advices about the situation of the mental health. and then to try to also bid proposals and to check in how the importance for the indigenous community, the spiritual and mental health, and to the medicine or the traditional medicine, and to try to share in also this knowledge like the one science, because sometimes the community or the scientificals, they say that the knowledge is more or less than they not. But in the truth, this current pandemic or the COVID, they give it the good examples, because all the people in the world to try to also combine the science with the traditional medicines. This is the one good thing, because it's no extended fighting when the community's science is also to try to combine the knowledge with the new technology, with the new information, and to try to improve more to connection and get good ways, and also to try to protect the Mother Earth and not get more bad effects for these actions and the climate change, right? And then also in the regional level, I have the one process when the PAHO for to try to implementing one planning for let me remember, sexual, I don't know, remember.
And reproductive
yes,
health.
Yes, this is the wide thing also, is they working together to try to also implementing these strategic new methodologies, and to try to say this is the example, this is the wide way the indigenous people say to combine and to try to making good actions. And then this is the thing to asking at the world for support the indigenous youth people action, because if it not include the indigenous people in this solution, no be more humanity, right? And then thank you again.
Thank you very much for that, Jessica. Absolutely, message well taken. We absolutely need to have a much more holistic vision of health that considers every single dimension of health and well-being. But also need to be more cognizant and inclusive of the value and importance of different forms of knowledge, that traditional knowledge that is so valuable to complement the scientific knowledge that is also needed to develop robust, evidence-based, nature-based solutions. So thank you very, very much for that, Jessica. And building on that, our next speaker, Jonathan, who is the Executive Director of Health in Harmony, is certainly no stranger to the challenges and the need to listen to what Indigenous communities have to say, and to harness that knowledge to meaningfully implement nature-based solutions. I think, Jonathan, that the Health in Harmony program really speaks for itself. You've got incredible case studies coming from Borneo to Brazil to that are also being expanded to other parts of the world. So incredible opportunities to really scale this up. Please share some of those opportunities with us, and thank you so much for joining us virtually.
Christina, thank you, and thanks to everyone. It's a really an honor and a pleasure for Health in Harmony to be invited to participate in this event. So we all agree that the interdependent relationship between nature's collapse and our species' deteriorating health is obvious and irrefutable. The number one threat to human health is the decline of nature, which is happening at unprecedented rates. So this begs the question, are global health strategies, both governmental and non-governmental, are they serious about improving human health if our health systems aren't focused on both improving human health and improving ecosystem health? Our organization, Health and Harmony, we have 15 years worth of experience investing millions of dollars into the climate critical wisdom, guidance, and the systems-oriented solutions of rainforest peoples from the Amazon to Indonesian Borneo to Madagascar and beyond. Now, based on our evidence, we hypothesize that health systems globally could anchor a planet-wide climate solution if these health systems are reimagined according to the design wisdom and the nature-based solutions of rainforest peoples. How did we arrive at this hypothesis? Well, during the last 3 decades, Borneo has experienced some of the fastest rates of rainforest loss on Earth. Now, to understand if and how we could assist communities to reverse this rainforest loss, in 2007, Health and Harmony conducted hundreds of hours worth of radical listening with communities residing in some of the highest risk areas for rainforest loss. Radical listening is simply our methodology. It emphasizes listening to communities without judgment, without inner bias, and most importantly, with a radical commitment to understand and invest precisely in the solutions that communities themselves design. When it comes to reversing tropical rainforest loss and thereby cooling the planet, the real experts are rainforest communities themselves, and their solutions for reversing local forest loss are consistently systems-oriented. And specifically, their solutions unify what practitioners and policymakers would label global health, livelihoods, and conservation sectors. In 2007, at our first site in Indonesian Borneo, more than 36 communities concluded during hundreds of hours of radical listening that they could guard and protect their forests if they had access to 2 things. First, quality, affordable healthcare access, and second, training and alternative livelihoods. So we invested precisely in their guidance. We established a medical clinic on the edge of the rainforest, and we initiated a job training program in organic farming and other trades to justly transition thousands of loggers into safer, better paying, and ecologically beneficial jobs. The communities in Borneo designed a funded healthcare model that linked logging rates to healthcare costs. So the lower logging rates reflected in lower out-of-pocket contributions to care. This was monitored by forest guardians. These are individuals identified from within the communities themselves, and the communities designed and encouraged a non-cash payment mechanism for healthcare at the clinic. Payment in the form of tree seedlings and manure, which were used in our reforestation and the alternative livelihood initiatives in the program. Now, I just want to share my screen and show one slide. The communities in Indonesian Borneo were right. Their design, their systems design was right. Their intersectional approach worked. Scientists at Stanford University analyzed the first decade of data from this proof of concept program and published the 10-year impact in the Proceedings of the National Academy of Sciences. The analysis demonstrated that between 2007 and 2017, so during this decade, Health and Harmony's investment of $5.2 million into the community design solutions resulted in some pretty impressive outcomes across what we might call the planetary health space or the One Health space, or across multiple sustainable development goals simultaneously. This included a 90% reduction in the number of households reliant on logging for their livelihood. We saw the prevention or the averted loss of $65 million worth of above ground carbon that was not released into the atmosphere, 21,000 hectares of secondary forest regrowth from previously denuded land. Rainforest thrived, rainforest photosynthesized, and it drew down enormous amounts of atmospheric carbon dioxide. Furthermore, nesting sites for 2,500 critically endangered Borneo orangutans proliferated in these secondary and primary forests. The intervention also contributed to a 67% reduction in infant mortality in the hospital's catchment area of about 120,000 people. So a 67% reduction in infant mortality and significant declines in the prevalence of malaria, tuberculosis, diabetes, and other common morbidities and common diseases. By trusting the rainforest people of Borneo's collective wisdom, we were able to understand the true meaning of what good health entails. The interdependence between a thriving rainforest and their own physical and economic and mental thriving. This was intrinsic to their perspective and into their design. They naturally designed a reimagined health system, one that operationalizes the fundamental interdependencies between their own well-being and the well-being of their rainforest ecosystem. They understood that a health system can't deliver sustained human health if that health system isn't also addressing the health of nature. And we all know today that the health of nature is the primary determinant of our species' health. In applying their own wisdom to rainforest protection, they reimagined a planetary health system and designed a global climate solution. So we see a pattern emerging from the radical listening programs that we have conducted across the tropics since 2007. Local and indigenous rainforest peoples rather consistently conclude that they are able to better guard and protect and expand their rainforests when they develop a solution that is anchored in access to affordable quality healthcare and ecologically beneficial alternative livelihoods. In Manombo Special Reserve, where we work in Madagascar, access to quality healthcare and livelihoods that focus on improving food security helps rainforest peoples avoid being forced to rely on extractive coping strategies during hunger season. In parts of the middle lands of the Xingu River Basin in the Brazilian Amazon where we work, indigenous and traditional rainforest peoples are forced to travel long distances in order to seek primary health care. So they must travel long distances out of their rainforests to seek medical care in faraway cities. This leaves the forests unguarded behind them. It leaves the forests vulnerable to land grabbers, to cattle ranchers, and to agribusiness. So bringing quality health care directly to them at the source of their life and livelihoods allows them to stay in place and guard their forests. Now, in Madagascar and in Brazil, just as in Indonesian Borneo, rainforest communities are designing solutions for forest protection that operationalize the dependencies between their human health and the health of their rainforests. In effect, they're reimagining the very scope of a health system based on their holistic understanding of health. So following their lead, we hypothesize that health systems globally, if similarly reimagined according to this broader ecological understanding of our health, could revive and protect jeopardized aquatic and terrestrial ecosystems and thereby cool the planet and reverse nature's collapse. Christina, thank you so much, and over to you.
Thank you so much, Jonathan. I think that the enormous success of this award-winning initiative has really, speaks for itself. I like the way you said that. It's really not just about safeguarding health. It's about reimagining and redesigning health systems to jointly account for the protection of human health and nature and our environment. So thank you very much for sharing that. But bringing that one step further and drawing on 15 years of experience, very tangible outcomes. I mean, in some communities, you've achieved up to a 65% drop in infant mortality, as your results show. So, what advice do you have for policymakers here at COP27 to either scale this up or to raise ambition for nature-based solutions for health?
It's a great question, and I think you and the speakers who opened the panel said it best. And in my words, I would say that vis-a-vis the grand challenges that we face today, humanity's grand challenges, the climate crisis, nature's collapse, pandemics, social injustice, I would humbly argue that no institution is built for the purpose of overcoming these grand challenges, because our institutions are siloed. Our institutions are focused on health, or focused on nature conservation, or focused on finance or education. And rarely do our institutions and do our policies reflect the need to operationalize interdependence. So we have got at ministerial level, at the multilateral level, at the government level, at the donor level, at every level, in my humble opinion, we have got to understand that we need to work outside of our silos, right? Ecology, ecosystems, nature doesn't understand silos, right? And so knowing that we are one animal species on the ecosystem, Homo sapiens are but one species on the ecosystem, we need our institutions and our policies to start to be aggressive towards operationalizing this fundamental interdependence between our species' well-being and the integrity of the ecosystems in which we live.
Brilliant. Thank you so much. I think that advice is very well taken, and we very much look forward to embedding that in the upcoming report as well. So thank you so much for that, Jonathan. Thank you for highlighting the need to really overcome those institutional silos within which we frequently operate. And now we move to look at the humanitarian sector, which really doesn't have an opportunity to operate within institutional silos. They have to respond to critical emergencies in the here and now for various populations and events. And we have now the experience of Carol, 25 years working in this humanitarian sector. You are now leading a program called Action on Climate Environment within Médecins Sans Frontières. What is it that you can share with us? What are some of the challenges, impacts, examples that you can share from this experience in this important program? Thank you.
Thank you so much, Christina, and thank you to my fellow panelists, Ryan, Jessica, and Shadia. And also thank you to Dr. Nira and Stuart from the IUCN, and all of you for joining. So questions, how does MSF, and Jonathan, sorry, you too. I think what's important is that MSF is seeing the consequences of the climate crisis, these cascading crises, pandemics, the climate crisis, biodiversity loss, systemic inequity, exclusion. And for us, I just want to tell a couple stories. The word nature-based solutions is new to our organization, or not all of us, but some. We're a 66,000 strong workforce in over 72 countries. And our main goal is needs-based, independent medical humanitarian assistance. But nature is everywhere. And in the first job that I had in southern Sudan, during a famine, what struck me was we were working on, there was severe acute malnutrition. Oh, can't hear me? Oh, okay, sorry. Thanks. Severe acute malnutrition. Thinking about diseases like, maybe I hadn't heard of them, sleeping sickness, schistosomiasis. These are climate-sensitive diseases. The point I want to make was, while we were responding to this, severe malnutrition, where children were literally dying of hunger and pockets of famine even, someone said, oh, there's so-and-so from Vétérinaires Sans Frontières, so Vets Without Borders, and he was working on a rinderpest outbreak, so an outbreak that affects cattle. So clearly, humans and the nature around them is something we think about, but what we're thinking about much more now too is how do we assist people who are most forgotten, most excluded, criminalized, with their health needs and their mental health needs. So I appreciate that came up by Jessica and Stuart. But also be thinking about how do we not only do no harm as medical humanitarians, but this today at COP and going forward, I think we have opportunities, like you said, about how can I want to give some examples of how colleagues are thinking too about how we're adapting our medical humanitarian response. But apart from our emergency medical assistance, we also believe in speaking out. We also believe that we have to share what we see. So I think going forward with nature-based solutions, what we can be doing is raising what we're here at COP for, and in other fora, locally, nationally, regionally, is speaking about what the colleagues and communities are experiencing. And early on, we thought of it in Earth Day 1996 even, about, or it was a bit later actually, 2000s, the Aral Sea drying up because of industry. And then what's the health impact? It's people having major tuberculosis outbreaks. People lost their lake, this massive sea because of industry. And we're seeing that today. My colleague Caroline mentioned in Venezuela with mining. We're seeing this in Kyrgyzstan with mining. We're seeing it in South Africa in Rustenburg with platinum mining, and also with extreme weather events. So two other examples I want to give is colleagues in Médecins Sans Frontières, doctors, nurses, midwives, water specialists, the people who make the project run are also saying. There's an example of a colleague who said, when we put in a new clinic, why would we not put in trees? The trees have, so much positive for humans, but also mental health impacts, fruit-bearing trees, shade. And then we look at examples like in Bangladesh, where we work with over 1 million Rohingya refugees, and it's an area where there's landslides. Children have drowned in latrines. It's an area where there are extreme health needs, and then you have the cyclones, all of these cascading crises we're here talking about at COP. And it's not something we did, so we work on with UNHCR on using solar water pumps. So thinking about, in a situation of a disaster where 1 million people are forced to move, making sure that we're being ecologically and responsible. But then we heard about a project too about planting 27 million saplings, and that has, and so what's possible here today are partnerships. So we're not experts in that. We're experts in emergency medical care. But I want to mention Madagascar because Jonathan, who's here, and Balai, his colleague from Indonesia, what we're piloting with Health and Harmony is in Madagascar, where in the last while there have been back-to-back cyclones, you have deforestation, you've had years of extractivism, and what we're excited about, or what we're extremely worried about, is high childhood malnutrition. So that's what the program right now is happening with severe acute malnutrition. But what we're doing with Health and Harmony, I'll be very quick, but this is an opportunity for MSF to learn more and from you and to share about what is a planetary health operationalization of a medical humanitarian response. So we're really excited about what we're going to learn with Health and Harmony, and also we're helping them with water and sanitation. So this reciprocity that that we're going to gain out of these partnerships. So I just want to end quickly. Also, you mentioned zoonotics, Marina. I mean, today our colleagues are working hard on Ebola, Sudan virus, in Uganda. And with the COVID pandemic, we had to adapt all of our operations. And our colleague, Dr. Maria Guevara, reminded us too about not only when these vectors are moving, there's new soils, there's new hosts, human. They're getting stronger. So their adaptation is actually more health harms. So whatever we can do together to, prevent, to understand what's coming, is going to be helpful. And yeah, Lassa fever in Nigeria right now. These are what we're working on day to day with communities. So I want to conclude with just as what we can do is we can, we're with some very excluded and exploited peoples, but what we can do is see what are they doing on nature-based solutions, but also what are the consequences? What is MSF seeing? How are we responding? What are the mental health, responses and consequences, and what are the co-benefits of health action? Okay, I'm wrapping up. Because we also do advocacy, so that's an opportunity. We know there has to be more money, new and additional money for adaptation, and we know that nature-based solutions is also adaptation. And yeah, I think we do operational research too. So if we can help with collecting knowledge of the communities and learning through our partnership with Health and Harmony about how to think with this planetary health lens, because we know the health of humans is the health of the planet. Thank you.
That was absolutely brilliant, Carol. Absolutely. Thank you for bringing in adaptation, because it's true. Nature-based solutions is not just about climate mitigation. It's also very much an opportunity for adaptation. And I think that the example of the work that you do together with Health in Harmony bridges across both of those. I was very excited to hear things such as reciprocity. I think that these partnerships that you're talking about really are a testament to scaling up prevention, to which has been largely neglected in this sphere and in the policy-making sphere. It's an opportunity to learn from each other and to work across the silos that Jonathan was talking about earlier, to address the full range of health impacts and outcomes that Jessica was alluding to earlier, to bring in leadership from youth, as Ryan was suggesting at the very beginning of this talk, and to delve a little more deeply into that, into the power of that cross-sectoral collaboration, into the power of working together. We now have with us Dr. Charia Wanus. Very pleased to have her with us. Charia is, I always call her, and she knows this, the quintessential One Health expert, because she has background expertise and has worked in each public health, animal health, in the humanitarian sector, in disaster risk reduction. So we could really say that that multidisciplinarity and breaking across silos, Charia, is really in your DNA. But what is it that you can tell us about how can integrated approaches such as One Health really help us to scale up nature-based solutions for health, whether it be for human health or for ecosystem health or even animal health? Thank you, Charia.
Thank you, Christina. Thank you very much, first and foremost, for WHO for inviting us to be part of this event. I hope you can hear me now. Okay. It's about One Health, and I think Maria and also IUCN alluded to the One Health approach, which is currently now we have seen a lot of recognitions and great interest in adopting the One Health approach and implementing it in the field. And this is because of the COVID-19 pandemic and then the following monkeypox pandemics and Ebola and other pandemics. People recognized, including policymakers, that we need to break these silos between the sectors and the disciplines if we are to prevent the pandemic from happening in the first place. Otherwise, we will continue to be in this cycle of panic and neglect, and we will continue to respond and lose so much lives and livelihood because of the pandemic. And also addressing this social, economic, environmental challenges, why we are having this increased severity and increased frequency of pandemics. because we have drivers at the upstream like land use change, climate change, biodiversity loss. These help to increase the interface between human and animal, especially wildlife maybe, and other factors that increase the likelihood of having these repeated outbreaks and pandemics. So if we are to prevent these from happening, we have to adopt the One Health approach. And just last year, or earlier this year actually, in March, we have our One Health high-level expert panel. They came up with the One Health definition, which is an integrated approach that brings the sectors, the disciplines, but also the segment of the society, the community, the youth, the indigenous groups, the traditional knowledge, together to work on prevention and reducing the risk in the first place, but doing so while at the same time contributing to sustainable development. And there's where nature-based solution comes, because it's the action that protects the environment. So when we are working to reduce the risk, we have to keep in mind that we are doing this in harmony with our nature and our Mother Earth. And I want to also share with you the following this, we have developed the joint plan of action as the quadripartite for global organizations. FAO, the Food and Agriculture Organization of the UN, the UNEP, the UN Environmental Programme, WHO of course, and the World Organization for Animal Health, WOHA, which I represent today, but also I represent the quadripartite agencies. We came together to form the collaboration on One Health. Before that, we were 3 agencies only, but this year we welcomed UNEP into our alliance, into our collaboration, to ensure that environmental aspects of One Health are adequately reflected and addressed in our work. And to do this, we developed the joint plan of action, which will present to this conference on Friday morning. So I hope you can join us. And this plan has 6 action tracks. One of them, it's about integrating environment into One Health. And for that, we outline some activities, some deliverables. Importantly, we have one on data, on evidence, on knowledge. How to bring this data from the environmental sectors into the health sectors. How to understand better climate-sensitive diseases. How to understand better the impact of climate on human health, but also on animal health. It's a very important aspect that we largely neglected in our operations. But if we are working together, we can ensure that all of these are adequately and effectively reflected in our work. And again, the issue of finance. We know that finance is very important to have operations in the field and to scale up pilot projects. But we know that we have limited funding for One Health. And if we have some funding, it usually goes to the response to health emergencies, but very little goes to prevention. We have to shift this pattern and this trend. We have to invest more on prevention to ensure that we really reduce the risk of pandemic. Over to you, Christina. Thank you.
Brilliant. Thank you so much for bringing that in, Shadia. So yes, absolutely. We need to scale up our investments in prevention. In fact, as you were saying that, I was just thinking, how true is that? I mean, when you were saying a lot of the investment is actually not directed at prevention, we can say that 3% of total investments are actually invested in prevention. So I think that we can do a lot better than 3%. And in so doing, we actually reduce the need for emergency response. I'd love to hear, actually, Carol, how you feel about that. Is that what do you think? What do you think in that regard?
No, it's like what happened today and all the work that you've all been doing building up to this is extraordinary. And it's so incredibly important to have the prevention side because, you know, we're talking about nature-based solutions at COP. We're talking about loss and damages, people who contribute least, like the youth and indigenous communities and other communities. So, I mean, what I'm learning, and I mean, being here with Médecins Sans Frontières, we have this wonderful partnership with Health and Harmony, which I hope we grow more of them. But with humility, we come here on this topic. But I just keep hearing about the return on investment of nature-based solutions. Like, we're not talking, money in people's pockets. We're talking about lives and how effective nature-based solutions are. So it is medicine, as you said, and you're a medicine. But anyway, so I think it's something that we need to explore. We will explore more, and that's all. Thank you. Can I say two quick things? Mobility of people is also mobility of their livestock. And there's the conflict aspect too of you cut down the trees, you took the resources, you got to look for it, and that's conflict. And we're hearing about that from our colleagues. You know, the radical listening we're learning about with Health and Harmony, and others, local traditional indigenous knowledge, and most vulnerable peoples that we're here to talk about, and access to healthcare for all. And the nature-based solutions plays a big part in that too. So thanks.
Thank you so much for that, Carol. I'm sorry to have put you on the spot, but we were talking about, you know, prevention versus emergency response, and emergency response is something that you really have to deal with on your day-to-day through the incredible work that MSF does, which is why I had turned it over to you to see. But you see, even the humanitarian sector agrees that we need to come together for prevention. And maybe just on a last very quick note, because I know we're running out of time, Shadia, you were talking about the Joint Plan of Action on One Health. We're talking about nature-based solutions. And we're talking about bringing in those environmental determinants, bringing in the environment sector to do that. So could you give us an example or two of what tools are out there? I mean, maybe there are people that would like to operate within this space. Maybe there are people that would like to scale this up. So could you give us one or two examples of other tools that are out there to implement One Health?
Thank you, Christina. We have a lot of tools under the One Health approach. Many of them we developed recently under the tripartite zoonotic guide. For example, the joint risk assessment, how to do it together, all the animal health, human health, and the environmental sectors come together to do joint risk assessment. We have also the multi-coordination mechanisms. And we have also the other tool that I would like to see, that the environmental assessment tool. And we are hoping that with the UNEP on board now, that we will work together on this, and we will have a tool that assess the environment aspect of One Health. Importantly, also, there is the health impact assessment. I think one of the speakers before, they mentioned it, that while we are doing development project, we need to include the health impact assessment and see what kind of impact we have on human, on the animals living in this context, and also on nature, on the environment. And then evaluate if we should go along with the current plans, or we should modify it to ensure that we safeguard our nature and natural resources. So there is a lot of tools, but the issue is the implementation. And also the alignment between all these tools. And for that, the quadripartite organizations, they are doing mapping of the important tools under the One Health approach. And then with the help of our One Health high-level expert panel, and then evaluate if there is any need or any gaps that we need to address apart from the one that I identified for the environment sector. Thank you, Christina.
Thank you, Shadia. There are, in fact, far too many tools that are actually out there to summarize in just a few minutes. So if anybody is interested, as you said, there is an event right here on Friday morning at 10 o'clock, I believe. And so they can certainly hear a little bit more about that. But now we have just 1 short minute before we close this panel. So I want to give each of you the closing word. 30 seconds. What is your message to this audience? How do we scale up nature-based solutions for health? And I would like to start with you, Jonathan, who is joining us there virtually. So please, what is your 30-second message?
Well, first off, thanks to you and to the panel. It's been fantastic to be a part of this. Look, we've never lived in a world where the health of people, the health of ecosystems, and the health of the planet could be effectively addressed in silos. Carbon drawdown and biodiversity protection through nature-based solutions are arguably the most important vaccine for people wherever they live on Earth. Cooling the planet and reversing biodiversity's collapse through nature-based solutions is universal health care. Thank you very much. Back over to you.
Brilliant. Thank you so much. And then moving on from that, let's maybe go to Carol. 30 seconds, no more?
Less. Partner like you've never partnered before. Exchange knowledge and tools. And listen. Thanks.
The Mother Earth is sick. The indigenous knowledge is part of the medicine. We need to work together for the action, for the humanity, and for the biodiversity. Thank you.
Yeah, I think the work we've done really shows that you don't need any more science, you don't need any more projects, you don't need anything. What you need to do is to go lobby outside in those negotiation rooms. This is a political propaganda that you need. Nature-based solutions are one of the political propagandas you need to push forward on those tables. You don't have to sit here and discuss the effects of it and the benefits of it. That's not needed anymore. We have the science, it's clear. You all mentioned it, our speaker mentioned it. Go out there and lobby for it to be in the plans of the governments.
And this is why we need youth. You see, this is a call to action. So to engage each one of you in next steps. And the very last word to you, Shadia.
Thank you very much. Based on what Ryan said, I agree with you, and I would like to emphasize that climate change and biodiversity loss are health crises. We need to act together to respond to them, to prevent them from happening. We have an opportunity in the pandemic instruments or accord that being negotiated under the WHO now. And we have the opportunity there to link them to the global agreement or other frameworks like climate change and the global biodiversity framework. So please help us to do so. Thank you.
Fantastic. So please help me in applauding this incredible group of panelists and thanking them for sharing this very, very rich experience. Thank you so much for joining us.
artists, scientists, indigenous leaders and communities. And we are currently in residence with the Wellcome Trust. Through our research, we are seeking to understand the suffering that occurs when the land is harmed. And we're looking from the perspective of land-dependent, indigenous and frontline communities around the world. Our research looks not only at climate change, land degradation and biodiversity loss, but also looks at historical forced severances from land and how this has impacted communities' mental health. It is well recognized that human health relies on a thriving, healthy ecosystem. Yet biodiversity loss is occurring at an unprecedented scale. We are losing species faster than we can discover them, which means we are losing potential medicines before we even know of the diseases they could cure. This is a well-known statistic, but I'm going to repeat it anyway. While indigenous people make up less than 5% of the total human population, they steward about 80% of global biodiversity. Changes to their ecosystems are more than a matter of survival. They share a deep layered connection with land and biodiversity on which their health, cultures and central identities rely. So it's my great pleasure to have an amazing panel of Indigenous young speakers with us today. And I'd like to hand over to Sylvia Kokunda, who is also a member of Land Body Ecology's research group and heads up the core team research taking place in Burundi in Uganda. Sylvia is the Chief Executive Officer of Action for Batwa Empowerment Group, a non-profit organization in Uganda working for the empowerment of the indigenous Batwa community. Sylvia is a member of the community herself and was motivated to establish the organization after seeing and experiencing the first-hand political, social and economic marginalization her community faces. Sylvia, it's my great pleasure to hand over to you to tell your story. Thank you.
Thank you very much. My name is Kokunda Sylvia. Thank you very much. My name is Kokunda Sylvia from the Batwa tribe in Uganda. I come from the indigenous community of Batwa in Uganda, whose habitat was the forest. It is from the forest where we got food, water, shelter, and medicine, and then eventually the forest was reserved. We were evicted from the forest in the name of conservation. A land where we as indigenous community had knowledge to conserve the forest, medicinal herbs that treated all kinds of diseases, beekeeping, and lived in harmony with our families because the forest favored us. Now the change of environment due to eviction leads to loss of our culture, language, family ties, thus causing trauma to our health. As if that wasn't enough, we were not given alternative way of living, not given a place where our culture can be practiced. Now we are losing our culture and traditional knowledge because it cannot be passed to the younger generation. Due to lack of land where we stay and practice our culture, in this situation we become vulnerable to effects of climate change. No access to land, health care services, education, food, name it all. Most of the countries have free service deliveries like free education, health services, clean water, sanitation and hygiene, but in doing that, a number of factors must be considered in regard to accessibility of these facility services. First of all, you have to consider the distance and also consider the accessibility. And when do these people, indigenous communities, go to health services if they are there? Do they receive eco services like other tribes? And more to that, the distances of which all this does not favor the indigenous communities because of poverty and the way they were evicted out without any consideration of the alternative way of living. Looking at someone's physical appearance does not guarantee his health. Mental health is key in considering the well-being of an individual. You might look at me when I'm looking good, but mentally you don't know what I'm going through. And this affects my well-being and the entire community that surroundings the environment. In order to achieve, everyone must be involved in implementation, leaving no one behind, as the theme of the SDGs. I request that in the support of indigenous communities in things that help them understand and learn traditional knowledge in relation to health and economic empowerment. From this scope, at least there must be policies put in place to favor people and the environment they are living in. For indigenous communities, we are part of the forest and the forest is part of us. As our research, land body ecologies, if one is removed, others are affected, just like the relationship between mind, body, and soul. These ones all have to go hand in hand. Indigenous communities must be supported to maintain use of traditional knowledge and resource management. Thank you.
Thank you, Sylvia. We're going to hopefully have a good 20 minutes for questions after everyone's spoken. So it's my great pleasure to introduce to you Latanya Balai Jandum. She's a 20-year-old indigenous environmental activist descending from the Dayak tribe of Borneo Island, Indonesia. She grew up surrounded by traditional wisdom that calls for the protection of both nature and culture, which is translated into years of activism across local, national, and international platforms. She is also studying a Bachelor of Medical Sciences degree at the University of Sheffield.
Thank you, Victoria, and good afternoon, everyone. The forest is our vein. It is our lifeblood. It is where the very force of life flows through. This is a phrase that I heard from the forest guardians of the Nangalauk village, who protect about 1,400 hectares of peat and riverine forest in the heart of Borneo, which is home to 200 households and over 700 people, all of whom depend on the forests for their life. The forest is our father, the land is our mother, the water is our blood. This phrase comes from the heart of the Dayak Iban Sungay Utik people, an indigenous community in West Kalimantan that for generations have lived by the rule of protecting their 10,000 hectares of customary forest whilst respecting the Dayak Iban culture. Two different phrases, but the same powerful and unifying message. And while indigenous peoples and local communities from all across the globe will live by their own version of these phrases and ethos, we all share the same narrative, that there is a deep and immediate connection and reliance of us as humans on the natural world that surrounds and sustains us, that the trees, mountains, rivers, and forests are our veins and our lifeblood. I descend from the Dayak people, the original inhabitants of the island of Borneo. And while my parents moved to the central Java island where I was born and raised, they continue to teach me the values and wisdoms that our ancestors have passed down to us. They told me that the two most important things to protect in life is nature and culture. And these two aspects integrate into our role as forest guardians. Because for our people, the forest is more than just the tall standing trees or the black and white hornbills that fly across the mountains. When we protect the forest, we are protecting our source of life, our source of culture, our source of identity, and what lays a foundation for all of these things, our source of health. Indigenous peoples historically built healthcare systems that are largely based on the integrity of the environment around us. So on a wider level, we rely on the ecosystem services, such as the provision of clean water and clean air that our forest provides. And this plays a vital role in the health of our communities, for example, through hygiene and sanitation. And then on a more clinical basis, forests become the ultimate source of medicine, or traditional medicine. For us, because we have experts in the community who have the knowledge of identifying medicinal plants in the forest and using it to treat a variety of diseases. I remember a couple of years ago, I was walking with the indigenous tribe leader in Sungay Utik, and we were walking into the forest, and he was just able to name every single plant that we passed by, their medicinal properties, and what sickness and diseases that it is used for. And beyond the physical benefits for the community, healing traditions and practices also have positive psychological, emotional, and cultural effects for our community who practice it. And this is forest medicine in action. And before being exposed to diseases that are outside of our health profiles, this indigenous healthcare system that relies on the forest and nature, it works. And it's exactly what has been sustaining our communities for generations. But as the world shifts and we become more and more connected to different populations, maintaining these indigenous healthcare systems have become more difficult. One of the examples is in the existence of the medicinal plant itself. When forests are destroyed, when our lands are grabbed and encroached and biodiversity is lost, our medicinal plants also start to disappear. In addition, documentation of these medicinal plants have also been a difficult challenge, and keeping the indigenous knowledge alive is hard because of this. Currently, the knowledge of our healers is not documented and have only been passed on through word of mouth. And with the generational gap between our elders and the current young indigenous youth, this poses a threat for the existence and persistence of our indigenous health systems. So there is a strong need for intergenerational transfer of knowledge so that we also understand what are the medicinal plants that exist and how can we use them to treat us ourselves. And I have assisted in the creation of a booklet that contains a list of the medicinal plant in our community, but that is just one of many indigenous communities who need this kind of assistance from a global level. And the final and biggest challenge is the destruction of our forests and nature itself. Indigenous communities, we see ourselves as inseparable from the natural world around us, which means that as we continue to lose our forests and biodiversity, we are losing that knowledge. We are losing that healthcare system and cultural practices that are the foundation of our health. So I will close with 3 calls to action, especially for the world leaders at COP27, to ensure that indigenous traditional knowledge and healthcare systems are protected. Number 1, prioritize the protection of our forest and biodiversity. We need to remember that the health of the forest is the health of our people. And not just indigenous peoples, but peoples living all across the globe. So forest protection must be a priority agenda that comes out of COP27. Number 2, revitalizing the indigenous knowledge and wisdom that our communities hold. Not only are they important to the health of our communities, but they are important to every single one of us in this room and every single one of us in this planet. And as a medical science student, I also acknowledge that it is these indigenous healthcare systems that have laid a foundation for how modern medicine and healthcare is developed and accessed. So we need to ensure that documentation and proper credit is given to our knowledge systems and traditional practices. And finally, decolonizing the systems in which we operate. This means that we need to be shifting power back to indigenous peoples and local communities who are at the front line of forest protection and in turn the health of everybody in this world. It means allowing us to be included in decision-making processes and negotiations that take place within and beyond the COP27 venue that has to do with our territories and our people. It also means shifting from the traditional siloed approach of separating environment and health and into integrating the two deeply interconnected areas, just like how indigenous peoples and local communities have been doing for generations. These are just three of the many ways that we can protect and empower indigenous knowledge systems from across the globe, and how we can uplift their voices in the fight against the climate and health crisis. And from now on, we have to recognize that indigenous peoples and local communities are not just victims of these crises, but we are a powerful solution in protecting the forest that is key to reversing the impacts of the climate crisis. So we have to engage and include ourselves and our communities in the protection of the environment. Because what is the forest if not the vein and lifeblood of each and every one of us? Thank you.
Thank you so much, Bilal, for those powerful words. Just before we move on to Cindy Kobe, our next speaker, if the technicians at the back can hear me, we have Vishala in the waiting room who would love to listen in before she joins us virtually. So yeah, if you could please let her in the waiting room. Thank you. So we should have two more speakers. We have Cindy here, who I'll just introduce, and Archana, who is running from another talk, hopefully will join us in the next 10 minutes or so. But first of all, yes, I'd like to introduce Cindy Kobe. So the Ogiek People's Development Programme are our land body ecologies partner based in Mau Forest in Kenya, of which Cindy is a representative. Cindy is a young Indigenous leader from the Ogiek community of the Mau Forest. She is passionate about Indigenous people's rights, climate justice, and women's rights. She is a trainee advocate at the Kenyan School of Law and also the chair and co-founder of the Youth Turap Trust, formerly known as the Ogiek Youth Council. The organisation is hosted by Ogiek People's Development Programme, and she works with Indigenous girls of the younger generation and Indigenous youth to rehabilitate their ancestral home, Mau Forest, and is also creating awareness on climate change issues. Cindy is also a 2022 Max Tobisser Edkins Climate Ambassador and a 2020 participant of the Global Leadership School of Indigenous Women and a 2021 Fellow of the Columbia University's Summer Program of Indigenous People's Rights and Policy. So as you can see, Cindy is a very experienced speaker and we're honoured to have her with us. Over to you, Cindy.
Thank you, Vicky, for the introduction and for having me as part of your panel. As Vicky introduced me, my name is Cindy and I'm from the Ogiek Indigenous community. And the Ogiek community, it's a hunter-gatherer community of the Mau Forest. And we have been living in the forest for all our lives, literally. And we have been facing a lot of evictions. Evictions have been we've been facing for as long as I've been alive. I've been seeing my community being evicted from their lands. I have seen my family members leave their homes. I have also seen my aunties and my cousins leave their homes, and they go and live elsewhere, far from the land that is connected to their identity, to their everything. And this in turn affects their mental health. It affects their well-being. It affects their source of livelihoods. It affects their source of food. It affects their water, because at the end of the day, once you're evicted from your land, you do not have any source of income, because you're used to using your land to maybe for beekeeping, as an example, because that's one of the activities that our community is part of. And also, the other thing is that they also cannot be able to take their children to school because of poverty. This in turn, it's a whole circle of the effects of the evictions. And this all affects our mental health. It affects the conservation of the lands. It affects the protection of our biodiversity. It affects the protection of the medicinal plants that are in this forest. And why am I talking about all these evictions and traditional medicine, you might ask? The reason why it is important to ensure that indigenous peoples are staying in their ancestral land and they have access and control of these resources is to ensure that they can protect the medicinal plants that are in the forest. And at Ogiek People's Development Program, we have a herbarium where they're planting the herbal herbs, the herbs for learning, to ensure that we are passing this knowledge to the younger generation, from the older generation to the younger generation, because this is something that is lacking. We have seen that it's lacking because most of the younger people are leaving their ancestral homes and they're going to the urban areas to access education, to access healthcare, and once they leave the ancestral lands, most of them do not come back. So we ensure that that this knowledge is transferred from this generation to my generation, and this has been put into practice. I'm a good example of the intergenerational knowledge exchange, because I am very close with my parents and also my grandparents. They have ensured that they transfer the knowledge that they have from them to me, and I'll give an example of one of the herbs that my grandmother uses, especially when I have a bad flu or when I have a stomach, like an upset stomach. She ensures that I have enough medicine to heal my stomach. So that's an example, and I ensure that I keep this medicine, and I will teach my children, and my children will teach their children, and this knowledge will be transferred to all the generations. And I would just like to encourage each one of you to ensure that you're teaching your children and you're ensuring that there is an intergenerational knowledge transfer, because once you know something and your children do not know, or other generation, it doesn't have to be your children, it's important. It protects this knowledge. It protects the traditional knowledge of indigenous people. It protects your knowledge, your mother's knowledge, and it ensures that you're also protecting your identity in return, because as an indigenous person, your identity is your land, your identity is your culture, your identity is what you believe in, and your identity is also your traditional knowledge, which is in this medicine. It's in our practices. It's in the hunting and gathering. It's also in the honey. For us, for the Ogiek peoples, we believe a lot in honey. We know that we boast that we have really sweet honey. I didn't bring any here, but we have really nice honey. And this honey is it's medicine for flu. It's also you can also use it for bread, and many other things that honey uses. And also something else is that the forest being a medicine is because of our elders. And our elders are the ones who have, they're the knowledge hubs. They're the knowledge hubs of all the medicines that we have, because they have medicine for various diseases, if it's a flu, if it's a stomach upset, if it is typhoid, and all those diseases. You are very sure that you can find medicine from our forest, from our forest, the Mau forest. And also the healers, the traditional healers, they also face various challenges. And as Dalia had mentioned, they do not know about the intellectual property rights that are there. They are unaware that once a researcher comes to your land, they have right to. There should be free prior informed consent. They should also be acknowledged that this medicine is from the Mau forest, and they should also benefit from anything that comes out of this research, of the research project. So maybe a researcher comes to Mau forest, and they're looking for the medicine of COVID. And they find the medicine and it works. The researcher will go back home and get all these benefits. and failing to acknowledge the Ogek indigenous community. And how does it affect us as a community? We will end up getting extinct. Our identity will also be affected in return, and all those other things. So I'll just encourage all the researchers to ensure that they are acknowledging indigenous knowledge, they're acknowledging the indigenous community, the indigenous land and the indigenous community. And also something else is that the healers, the traditional healers, are unaware of the value addition methods that are available, because once you grind the roots of a tree, you should put them at least in capsules so they can to add value to the medicine. But they are unaware of this, and they also do not have the resources that they need to package the medicine that they have. And that's something that we're working on. And also something else is that there isn't much documentation on traditional medicine. Very, very few research have been done, and that's why we're working with land body ecology for that, and also and other partners. And that is something that other indigenous communities should do. They should ensure that they're doing research on traditional knowledge, because it is very important. And this was seen during the time of COVID, when most of the people were relying on traditional herbs and medicine. They were not relying on this the pills. They were looking for ginger and lemon to cure a cold. They were looking for the leaves of the eucalyptus to open their nasals and the trachea. And those are just some of the examples of the traditional methods of healing that I have practiced and I have seen. And it is important to protect traditional knowledge. It is important to acknowledge indigenous people. It is important to acknowledge, to secure indigenous people's land rights, and ensure that you protect the identity of these communities. Because when you don't acknowledge either of them, you're making them extinct, and that is what indigenous peoples have been fighting for so long. Yeah, thank you.
Thank you, Cindy. Archana, welcome. Thank you for dashing over. I hope you're okay. Take 2 minutes if you need it. You're good. Okay. Well, I'm really pleased to have Archana Sarang with us. Archana belongs to the Khadia tribe from Odisha, India, and she is one of 7 members of the UN Secretary General's Youth Advisory Group on climate change. She has experience in advocacy and research and is working to document, preserve, and promote traditional knowledge and cultural practice of indigenous communities. Archana, we're here talking about forest as medicine. Over to you.
Thank you so much, and Johar everyone. It's a pleasure to be here amongst you all, sharing my thoughts. I would like to start with sharing a interaction which I had with an indigenous women leader. During pandemic, we saw a lot of community members, those who were living in the cities, those who had gone for work like labor work and migration for other livelihood issues. We saw during the COVID-19 pandemic, they were coming back to the forest, they were coming back to the village, and they were walking to the communities from the cities. And that is when I interacted with an indigenous women leader saying, like, what do you think and what is your perception seeing the communities walking back to the villages? And then she said, it's so difficult and pains me to see my community members walking back to the village without food, shelter, and in such a hot sun. We are here in the village, protected by our forest, because our forest gave us medicine, our forest gave us shelter, our forest gave us food during the pandemic. And I felt this interaction which I had with the indigenous women leader was so powerful, because forest and nature is our sustenance. It's which keeps us sustainable in terms of food system, our livelihood, our health system. And if we are away from our forest, then our protection shield is somewhere or the other threatened or weakens. The communities have been having stronger resilience because of their indigenous food system, because of the forest food system, and it is so critical to ensure that indigenous people and local communities have the rights over the land, forests and territories. Because if they don't have the rights over the land, forests and territories, then they are not able to access this forest-based livelihood. They are not able to access this forest-based medicines. And I think that's really critical, which also has connection with traditional knowledge and practices of indigenous communities, because these traditional practices and knowledge with our indigenous elders, but every day we are losing our indigenous elders, either because of, threat to the land defenders and environmental defenders, either because of imposition of developmental worldview and perspective. And that's why I feel it's really critical to have safe and enabling spaces and intersectional approach where we realize the importance of indigenous elders, not only in terms of biodiversity conservation, climate action, but more so in order to attain a sustainable world, more so in order to attain a healthy world, and which needs to come from having language diversity, which needs to come from making an structural effort where we are able to have meaningful leadership and participation of indigenous elders and indigenous young people having together a platform to dialogue. And today here at WHO platform, we are having this conversation of health, forest, and as an indigenous person, I would like to say that forest has a strong relationship with us in order to keep ourselves healthy. The food which we are having, I have been saying this, I would like to say this, everyone is talking about organic farming and how important it is in terms of health. But organic farming has been practiced by indigenous communities and local communities since ages, even when this terminology did not exist. Climate action, biodiversity conservation has been practiced by indigenous communities, local communities since ages, even when these terminologies did not exist. But where are these communities when in the decision-making processes? We need communities' perspectives and narratives weaved into these policies and practices, because ultimately these policies are being implemented on ground. And that's why I propose we need structural changes in national level and international level, incorporating indigenous worldview, their way of living and their governance system. Because often people say, what are indigenous people doing? What are indigenous people contributing? And I want to say that it's not only mere what indigenous people, what they do, but it's also about who indigenous people are, their relationship with nature, their worldview with nature, and more so importantly, how in a collective way and mechanism and their way of living, they have been leading a sustainable life, and they have been contributing towards climate action and also towards a healthy planet and healthy livelihood practices. So I would like to end my intervention and saying that indigenous people, local communities, young people should be leaders of climate actions and not victims of climate policies. We need to build this world on respect, love and solidarity. What is important is let's look out for each other, let's reach out to each other, indigenous people. And I, as a young indigenous woman, am willing to speak up. Are you willing to hear and act on it?
Let's see how this goes if you guys keep that mic. I have lots of questions, but I also do know each of you individually now, so I would love to offer it to the floor if anyone has any questions for any of the speakers. I'll bring you the mic, hang on.
Thank you very much. I just wondered if we can talk a little bit about how we can systematically document and credit indigenous medical knowledge in a culturally sensitive manner.
So I'll just try and repeat, but correct if I was wrong. How do you document and credit indigenous knowledge and what, sorry? And medical knowledge, yeah. So I guess around indigenous IP. Shall I hand to you, Chana, to start?
I think this is really important question because we have seen that how indigenous medicines and indigenous practices has been co-opted by communities and not given credits, and it has then later becomes to an intellectual property issue because like the communities, other communities come, know, learn, and then convert it into their own medicines and give the intellectual property rights and all of this. So I think this has been one of the major challenges, which again creates hurdles for indigenous people to open up and share the traditional knowledge and practices. So for me, how do we go ahead is that it's really important to go to the communities, interact with the communities, have dialogue with the communities, build a consensus with the communities, which is like free, prior and informed consent, and then initiate the documentation processes and then giving the credit to the community. So I think that's really important because the thing is, it also comes down to the world needs that, but are the indigenous communities willing to do that? Because it's again at the cost of being further marginalization. For example, if there's a medicine found in indigenous forest land, then there will be eviction of the communities from that place to another in order to, take up that medicines. So it also comes with a lot of threat. So I feel it has to be free, prior and informed consent of indigenous people and local communities, and more so a collective decision making processes. And I think, again, it comes down to, there should not be imposition of and on indigenous people, but rather it should be collectiveness and discussion and deliberation which will make difference.
Oh, and just to add to what Achana has said, we have various international laws and policies that protect indigenous peoples. We have the UN DRIP, and we also have the WIPO, and we also have the Nagoya Protocol on access to genetic resources and fair and equitable sharing of benefits arising. So you should ensure that you are familiar with these international laws, familiarize yourself with the existence of these laws, and also tell the community about the existence of these laws, because they do not know that there are international laws that protect their rights, that protect their intellectual property rights. Yeah.
Can I also add? Yeah, also just to add to what has already been said, one of the nonprofits that I work with is called Health in Harmony, and one of the principal approach that we use when working with indigenous peoples and local communities is called radical listening. And we call it radical listening because it's not radical for the communities, it's radical for us as the listeners. It's because we do it with radical love, radical empathy, radical respect, and putting the communities really at the center of the design, implementation, and evaluation of any programs that are done within indigenous territories. And I think one of the key thing to do is to train organizations and facilitators and anybody who will be coming to indigenous communities to understand tools like FPIC, UN DRIP, and radical listening, because they are the ones whose capacity needs to be built so that any processes that they do with indigenous communities are done with the basis of respect and mutual benefit. So that's also to add.
Okay. To add on the documentation of the indigenous knowledge and the knowledge of medicine. To my community, I believe that this one is key, because if this is not documented in the future years to come, this traditional knowledge will be no more. Because when it comes to the Abattoir community, we are denied access to this forest where we can get this medicine. Even our children, we just tell them about the medicinal herbs, but they don't know how they look like. Even when we try to access the forest to make sure that we get this medicine for our children, or at least for this show, we are killed, we are tortured. So this is all we go through. And like when we document our traditional knowledge, the medicinal culture, the culture of the Abattoir would be no more. Thank you.
Thank you. Any other questions from the...
Thank you. Very interesting. And two questions, if you don't mind. Kind of linked. One was, could you comment on, medicine, the loss of diversity, how it also affects nutritional health? Because that's, I work with I'm a medical teacher at a medical school in Northern Ontario, and that's a factor there, I think. As well as if you could comment on, somebody was mentioning about the documenting of the drugs. One of my students did a study who's indigenous, looking at the mushrooms that they use. They felt it reduced cancerous type growths. We extracted it, put it on cells, it didn't work. And that's when I realized clonally that that's not really traditional medicine, to take something, put it through test tubes and try to get a compound. So I was wondering if you also would agree that, or comment on the fact that the medicines that you're using have to be treated in a way that you've learned over the centuries, not just compounds that we can replicate and put into a test tube.
Okay, so the first question was around biodiversity loss and the effects on nutritional health. So I'm going to hand to you, Sylvia, on that. How that's affecting your community.
Yeah. So when I talk about this, I told you how our Abattoir community, how it used to live in the forest, and now we are evicted to make sure that they conserve this environment. And this eviction was not considered to us, because for us we had knowledge about the conservation of this forest, but we are evicted without the prior knowledge of us and not given an alternative where to live. And if we were considered at least like we are given land, we would get these medicinal herbs, we plant them here, and then we start practicing our Abattoir culture in that land. But here we don't have land where we are staying, and where we live, we are just squatters on other people's land where we don't have land ownership. And in this regard, we are exploited because of the nature that we are living in. Our culture is being used as a business because we don't have a voice. Many people come, they bring tourists, they say, you come and we show you the culture of the Abattoir. And then when we practice our culture, the money is paid to those people and not to us. Then for us, we are just paid like handouts, and all the money goes to benefit the people that are showing off our culture to these tourists. So it is really hurting, and we really feel the effects of climate change in regard to the eviction of us from the forest.
Thanks. Does anyone else want to comment on how it affects nutritional health? Yeah.
I think this is really important question. I would like to link it up with COVID because when we were under the COVID crisis, we were also facing the impacts of climate crisis. We still had cyclones, we still had unseasonal rains, and we still had heat waves. And it was like in March, which is a major source of livelihood season for our forest-based livelihood, we were in the pandemic, and there was a lot of restriction to go in terms of movement, and it was difficult also access these foods from the forest. And during that days when the COVID restriction was lightening, then we had massive cyclones. And then the entire food got spoiled from the forest. So I strongly feel that loss of biodiversity has a strong linkage with climate crisis and strong linkage with nutrition, as you have raised, because the impacts we are facing in terms of climate crisis is a loss of nutrition, because we are not able to have those food practices during that period of time, which not only helped us in an economic way but in terms of nutritional way. Because I know in my communities we have certain food system for specific seasons, which not only safeguards from economic, sustaining economy, but also it's more nutrition at that point of time, because that's the fresh you get. So I would like to emphasize that where are these loss and damages acknowledged? Where are these non-economic losses and economic losses emphasized in the conversation of climate justice? I think it's really important to also push forward from a lens of intersectionality, food system, biodiversity conservation, biodiversity laws, and more so climate action as well.
And the second question, let me quickly try and recap it. I think it was to do with collaboration between traditional knowledge leaders and scientists and the medical community, and whether that is needed or whether that is something we should be practicing, or how. Can I pass to anyone on that? Cindy? Great.
Yes, it is something that needs to be practiced, because I believe that traditional leaders are not, they are scientists, only that they are indigenous scientists, and they need to work together, because all the researchers, when they are doing their research, they first go to the land, they go and find the traditional healers, and they need to work together. And that's why we also have the issue of intellectual property. When there is the acknowledgement of indigenous communities where they have intellectual property rights, that is when we will see that these traditional healers and scientists are working together. So the only way we can that they have been working together. So let's just say they have not been. It has not been acknowledged that they are working together. Yeah.
Yeah, and I just want to add that I think there is this notion that indigenous knowledge and like modernity is two opposite things, but I think it's important to recognize that when these two collaborate, it can actually be beneficial for the community, for their health, for biodiversity and forest protection, because something that I always say is culture cannot evolve as a museum. Cultural practices, they stay, the principles, the essence stay, but the way we do it may look different, because for example, when it comes to forest protection, protecting the forest 50 years ago and protecting the forest today will look differently, right? We have new challenges, but we also have new opportunities. So it's about getting that bridge between indigenous knowledge systems and also like scientists and the more modern, understanding of the world, and trying to collaborate within that to make sure that it's beneficial for the local community and also for the global community.
To add on my colleagues' remarks, I believe that traditional knowledge and accessibility of these herbal medicines should be key, because I do remember that when we were evicted, my mother lost around all the siblings that are behind me. They all died because we had no access to the health care services. And these people, community members, had no knowledge on herbal medicines. For us, we knew, but the problem was that we had no access. We are denied access. So my mother would not risk losing her life to go back to the forest to get this medicine to help her produce. And she ended up getting all those miscarriages. I remember scenarios where she could move with the baby in her legs, trying to look for someone to help her get out this baby because she had no money to go to the hospital. And these people, they did it just like lively to just pull the baby out. So you see someone risking losing the life because of not considering like knowledge and also getting that herbal medicine. Thank you.
Hi, thank you so much. Following up on that, I'm really interested in how not only do we link the traditional medicine to the scientists, but also how do we make the money flow for things like that. In Scotland, for example, there are more efforts to prescribe nature, and there are things like forest bathing that we can try to get funding for now, also from insurances, healthcare insurances. So I was wondering, do you have examples on how we can really integrate forest as medicine within existing financial healthcare systems? Thank you very much.
I think what is also really important is I think there's a lot of willingness in what you shared. And I think that's what is lacking, willingness, intent, and political will in acknowledging these efforts. Because at this moment, the challenge is also, the denial, which is there that indigenous medicines are not effective. Indigenous efforts or traditional knowledge are not effective. So our fight has turned out to be so basic things where it is of mere acknowledgement and recognition. And as we move ahead, it's also important that how these stage of advocating or leveraging the prizes, livelihood, it also comes together with the community, and most importantly in a systematic approach and structure through the states and the non-state actors. And that's where I feel it's important to have an intergenerational, stakeholder consultation and dialogues on this, on identifying that what the communities would like to stage in terms of how they want to have the prizes and negotiations on this. Because it is very sad, because at times also what is the correct price which should be put, because it's a lot of livelihood, life, relationship of communities, and it's difficult to value, or it is difficult to estimate it. And that's what I feel is really important to be done by the communities, and communities not only at one place but communities across globes, which again brings me down to highlight that indigenous people and local communities are heterogeneous communities, and different communities at different regions have different realities, and that needs to be taken into consideration.
I also wanted to add that one of the ways that we can integrate forest as medicine and this intersectional approach to forest conservation and healthcare with financial systems is really to be investing directly in communities. So one of the nonprofit Health and Harmony that I work with, we've just launched a digital platform called Rainforest Exchange that allows not only governments and organizations and companies but also individuals to directly connect and directly invest in community-led solutions, because it is solutions that come from the communities that will take care of both forest conservation and healthcare and biodiversity protection, and also just improving the public health of the community there. And it's also important to note that a lot of the times these funding schemes and financial systems are very inaccessible to indigenous peoples. They come with a lot of rules, they come with a lot of regulations and things that they are demanding things from indigenous peoples that sometimes we simply don't have the capacity to do. So for example, monthly detailed financial reports of how the money was used and things like that. So it's also making sure that these communities have access and can actually achieve funding. The mechanisms and systems need to change. And one of the reasons why it is also important to make it more accessible is to eliminate the middlemen and facilitators needed for them to access that funding. Because the more middlemen are in the process, the less money actually goes to the community. So it's making sure that we are investing directly in communities and making sure that these funding systems are attainable for the communities to receive.
I'd just like to emphasize on the good political goodwill. Most of these researchers, when they are coming to do their research with regards to medicine, they always go through the government. They have to get a license to come and do their research. And once they get their license, it's important to ensure that you're developing, let's say, a contract with the community. If the research is a success, what will the community benefit? If the research, if it's maybe 30% of all the benefits, that's the kind of amount of money that the community needs to get. I'll just use an example of Kenya, of the Endorois community. The community, there's a lake called Lake Baringo, and Lake Baringo has this species that makes the jeans blue. And a researcher came to the Endorois community, and they got this species out of the land, and they went back to their country and did and made the jeans blue. And at the end of the day, the Endorois community were not acknowledged, they were not recognized, they did not get any amount of money out of this research. And at the end of the day, the community were not even aware of this research that was happening in the community. They did not, they just had the stories after, like long after. So that's just an example, and you should ensure that you have good relations with your county government. In Kenya, we have counties, and good relations with the county government, good relation with the national government, to ensure that you are benefiting from all the research that is happening on your land and territory.
We've got about 5 minutes left if anyone has a burning question. Yes.
Thank you. I'm Haitza Susan with the Climate Action Network from Uganda. Uganda has just recently enacted its law on climate change. My question to the lady from Uganda is whether efforts were made by the Batwa people through their member of parliament to ensure their interests were put into the Climate Act. Thank you.
I'll just check I got that right. Is it what efforts were made by the Batwa people to ensure representation at a political level? A member of parliament.
Thank you very much for that question. As in, most of us, we are affected because of lack of representation, as I had already said. Being minorities, we cannot be voted, and we don't have any representation on this all the government representation from the local government up to the top. So even when all those implementations are being done, our issues cannot be heard because no one to represent. We don't have a member of parliament that can take our issues, so we have not been done. Even when we try our effort to compete with others, still we cannot be considered. So that's the challenge that we continue going through.
Thank you. If there's no more questions, I'd just like to ask Vishala to join us online if she's there. Hello, Vishala. Can you hear us okay? Okay, we're just waiting for sound from you. Give us 1 second. Vishala, do you want to just say hello to me? We can check the sound.
Hello.
Hello, great. I can sort of hear you. Can we turn Vishala up, please? Thank you. So Vishala Padmanabhan is the founder of Buffalo Black Collective, a network of small holding farmers around Bengaluru, seeking to change the relationship between urban consumers and food. Vishala is a member of Land Body Ecologies, and I have asked her to give some closing remarks on our session today. So I'll just hand over to you, Vishala. Thank you.
Thank you. Thank you so much, Victoria. And thanks to all the panelists, the youngsters representing indigenous communities. I think it's brilliant to see you all being the voice, the young voice of your communities, and presenting your views. So what my interaction with the indigenous communities has been through the farmers who are settlers. I myself am a settler in one of the ecological sensitive areas around a national park, a forest in which there were many indigenous communities. And I think as people who are promoting organic farming, like at some point Archana and also another speaker pointed out, while we promote organic farming, we realize, and every time we are reminded of how human relationships and interactions between indigenous communities, farmers and pastoral communities have been broken, through these land transformations and conservation efforts that happen around the forest. So these have also, I think, contributed largely to commercialization of agriculture, and excessive use of agrotoxins also is something that we have constantly realized, especially in sensitive pockets where agriculture is practiced, say around forest lands. It just doesn't make sense to practice agriculture which is chemically intensive. But because I think largely because these human relationships where indigenous communities have been part of the process in some way or the other. Like, for example, there's a community of paddy farmers that we work with, and we hear stories of how years ago there was an indigenous community in the forest who could actually manage the rodent population, and the indigenous community had the knowledge to figure out the rodents that should be caught so that the breeding is controlled. The breeding of rats is controlled in the paddy fields, which meant the yield was protected, the crops were protected, and people did not need probably toxins to kill these rodents. But then after the indigenous communities were relocated because of forest right acts changing and then them having less access, so the cultivation of paddy was largely impacted. And we hear cases of farmers actually giving up paddy cultivation because of this loss of relationship. Yeah. So I guess the linkages, the human linkages also, the bonds have been broken by some of these policies, especially conservation policies, which has dislocated people. And yes, I think the dominant narratives of development seem to find structural support, but indigenous narratives, even in a country like India, also is so diverse that I still see that political will and administrative structures find it very difficult to include these diverse narratives, and probably also because we lack the will to decentralize administration, decentralize things, and look at how indigenous communities and the local farming communities could be included in the whole process. So I guess conservation policies centralized and focusing on species specific protection, or on somewhere around even commercialization of land, is definitely not going to help any of us in the long run. And like I said, there is definitely a rippling effect that we see when indigenous communities are impacted. Communities which have been traditionally dependent on them and have had relationship with them are also impacted. And I'm sure all of us are impacted by this, and at some point all these will definitely manifest in our relationships. And then when it comes to specific aspect of codependence of humans and nature, I think that's something we have not found acknowledgement at any levels, is what I would say. As much as one of the questions came up on how do we commercialize these healing practices. We do have forest walks offered as therapies, what I hear in urban spaces, but then how do we commercialize them, or how do we understand them? But then I think before commercializing there is a need to have dialogues and first an acknowledgement, probably from the scientific and also the medical community, that the relationship between human and nature is very, very critical for all of us. Even if we are probably living in a largely urbanized area, And somewhere I think the responsibility probably is also on the mental health professionals who are focusing on what I hear again in India is that there are a lot of mental health issues. It's increasing by the year. So probably understanding, beyond the physiology of human or beyond the medical aspects, and understanding that how much are we disconnected from nature, and how is it impacting us? How is it really impacting us? Is probably something that needs to be researched, because I feel in all aspects of health that is something that's largely overlooked. While there is definitely a large-scale acknowledgement of herbs and food coming from forests having healing properties, and I'm sure there are medical research going on that, but this intrinsic connection, which is not exactly physical through herbs, but the real connection that you have with nature is something that I feel I'm still missing. So I don't know if other countries are doing it, but at least in India, I know it is still largely missing here. So how can we prioritize certain things, and how do we look at conservation of biodiversity, and from an agriculture perspective, agro-biodiversity also, and how can we bring these ecosystems to speak to each other? I think there is, again, when I look at agriculture per se, there is so much commercialization of everything, including land, input, seeds, and inputs, because of these disconnects between the pastoral community and the agriculture community. I think unless we have a very, very systemic approach on re-looking at these interconnections and still bringing the balance between modern day needs, because I think in certain places I've also seen, like probably in our own place, I've seen denial of basic facilities like a hospital or a school to these communities, just so that denotification of the land and eviction becomes easier. But I don't think that is the way to be pressurizing people to adopt to modern ways or move away from their land. So I think apart from political will, a kind of a coordinated efforts from researchers, and also probably involvement, serious involvement from corporates who seem to commercialize many things, could probably a little bit of sensitivity in understanding these interconnections would be a great idea. And yes, when it comes to mental health, like I said, I think we still have a long way to go. While we have, within communities also we have certain taboos attached in India. I know that my villagers do not acknowledge mental health issue as a problem. So when we see, like, for example, when I see a 12 or a 13-year-old girl struggling with something, and I know that it's some disconnect, and then the fact that she is being put into another ecosystem, she's sent away to a hostel in a separate village, away from home, is affecting her. There is a large-scale denial within the community. So apart from awareness within the community, and I think to create that awareness, we need acknowledgement from the larger medical fraternity also on these deep issues that are actually manifesting in different ways. And so I think public investments also, especially for a country like India, public investments in these is, I think, very, very critical. And I don't see any signs of that happening at present. So I think all these dots connected kind of become very important for the climate mitigation narratives that we are talking about, including solutions that we seem to want in agriculture and expect agriculture to reduce or agriculture to sequester carbon or deal with climate issues. I think unless these human relationships are restored and these relationships between human beings and nature are restored and prioritized at all levels, I think it's going to be a huge challenge to be talking about climate mitigation. So thank you all for giving me this opportunity, and I'm still not sure if I was heard fully, but I'm just hoping the network has been fine so far.
It was great, Vishala, thank you. There was some singing in the middle, but I think we managed to hear you. Thank you so much for joining and giving us those last remarks. I'd like to thank all the speakers and everyone for joining us today for this really important conversation. And if we just would love to give everyone here a round of applause, we'll close the session. Thank you.
Good evening, ladies and gentlemen. On behalf of Nurses Across the Borders, the World Health Organization, the Federal Ministry of Health Nigeria, and the Delta State Government of Nigeria, it's my pleasure to welcome each and every one of you here to this side event being put together as part of our mitigation strategies as far as climate change and health is concerned. The theme of our side event today is the health implications of climate change and mitigation strategies. Before I announce the speakers of this event, it is my pleasure to let you know that today's event is very, very key in the sense that a lot has been said about adaptation, a lot has been said about climate financing, a lot has been said about smart cities, but very little is being said about empowering those who are supposed to form the forefront at the defense on climate change and its hazards. Tonight, I have on our panel distinguished members from the government services and from the civil society. I want to start by introducing the Commissioner for Health, Lagos State, and he is Professor Akinola Abayomi. You're welcome, sir. Lagos State is one of the few states in Nigeria that are taking great strides in promoting climate change and health resilience and mitigation strategies. Following that, I also want to introduce to us here tonight the Permanent Secretary, Delta State Ministry of Environment. She is Mrs. Dr. M.I. Oseji. You're welcome, madam. Just directly by the side of Dr. Oseji, we have a two-time mayor from Lagos State in one of the riverine states in the Federation, and his name is Honorable Adetola Ganiu. He was a two-time mayor of Ikosejiri, local government in Epe local government in Lagos State. You're welcome, Honorable. And to strengthen our partnership between the Global South and the Global North, we also have a partner from the United States of America, and that is Dr. Katie Hoofling. Dr. Katie is the Executive Director of Alliance of Nurses for Healthy Environment. You're welcome, madam. And last but not the least, we have Dr. Oma Perpetua Ofodile. She's the Deputy Director of Marine Environment and the Head of Climate Department of the Nigerian Marine Administration and Safety Agency in Nigeria. So they are in charge of the marine water. So it's a coalition of all experts that matter in trying to build mitigation strategies against climate change. Representing the WHO, who should join us, is Dr. Brahma Kone. Is the technical officer of the WHO Climate Change Unit. And so we are waiting for him. I understood this at another event. He will join us. Ladies and gentlemen, before we begin this discussion, I have very few facts to put before you. I call it my reality check. These are facts and not fiction. The reality of the climate change crisis and public health. Disaster risk is magnified by climate change. it can increase the hazards while at the same time decreasing the resilience of households and community. That's a fact. Every second, according to the Norwegian Refugee Council, every second, one person is displaced by disaster, making 60 persons per minute, 3,600 per hour, 86,400 persons per day, and 2,592,000 per month, with 31,104,000 per year. As we speak, we're going to be here for 75 minutes. So you multiply one person per second times 60, then times 75 minutes. That will tell you the number of people that are currently being displaced by disasters. That's a fact. Every year, the tobacco industry costs the world more than 8 million human lives, 600 million trees, 200,000 hectares of land, 22 billions of water, and 84 million tons of carbon dioxide. That was the WHO report May this year. The majority of tobacco is grown in low and middle income countries, where water and farmland are often desperately needed to produce food for the region. Instead, they are being reused to grow daily tobacco plants, while more and more land is being cleared for forests. Tobacco products are the most littered item on the planet, containing over several thousand toxic chemicals, which leach into our environment when discarded. Roughly 4.5 trillion cigarette filters pollute our oceans, rivers, city sidewalks, parks, soil, and beaches every year, according to the WHO. Now, for those of us who have been in Egypt, you will discover that cigarette smoking is, I'm not condemning them, but there is just no way you can run from the effect of the cigarette smoke, even when you are in the public transport. These are reality facts. Drought. The number of people suffering extreme drought across the world could double in less than 80 years, which has major implications for the livelihoods of the rural poor and can also lead to increased migration streams. There will likely be a large reduction in natural and water storage in 2/3 of the world, especially in southern hemisphere. Sea level coastal flooding events could threaten access of up to 20% of the global GDP by year 2100. The population of coastal areas has grown faster than the overall increase in global population. Infectious disease. By 2050, mosquitoes that carry vector-borne diseases like malaria could reach an estimated 500 million people. Global warming has led to a loss in biodiversity, resulting in increased transmission and incidence of the disease. Due to altered climate patterns, urbanization and deforestation, bats and rodents, which are responsible for 60% of the diseases transmitted from animals to humans, have flourished. Wildfires by 2030 could be 3 months longer in areas already exposed to wildfires. In Western Australia, for example, this will add up to 3 months of days with high wildfire potential. Why then are we here? We're here just to be a bit biblical with respect to everyone's religious belief here. There is a story of Noah and the ark in the Bible. The flood in the Bible did not come to humanity by accident. God warned humanity about the coming flood. Because God believed in resilience and preparedness, God asked man to prepare for the coming flood. Those who believed and got prepared were saved. That was Noah and his entire family. But those who refused to heed to the warning were perished by the flood. Exactly what is happening today. You and I were here in this conference drawing attention to the implications of climate change to humanity. But there is one thing that is missing. Humanity is not taking this campaign seriously. Why? Because they are neglecting the very critical section of this campaign that are responsible for building and adapting to the effect of climate change. That is the health ministry and the healthcare professionals and the healthcare providers. That is why today we have brought a lot of us together here this afternoon to discuss. Our interest is to see how we can build collaboration. A lot of prescriptions have been given to us externally, but we do not want prescriptions as solutions to our problems. We want to be part of the solutions. So, and we can only do that if we collaborate, and every expertise and funding that can be generated is brought to Africa that contribute less than 4% of the global emission, but yet we suffer more of the impact in our health and even in the degradation of the land and humanity. And so that is why this afternoon we have the caliber of speaker that was speaking here tonight is going to address this issue of the health implication of climate change and the mitigation strategies. And so, ladies and gentlemen, Ministers across the borders have been at the forefront of this campaign since 2004. The reason why we joined the UNFCCC was because health was missing. When we asked why did we want to join the UNFCCC, we said we want to promote the campaign for health and climate change. And that is why we're here. In 2009, 2010, we were among the WHO group that began the campaign to adding health discussions in policies and the climate change discourse. So without much ado, I want to start off this discussion by inviting to the podium who will be our first speaker today, and that is Professor Abayomi, who is the Commissioner for Health of Lagos State. We were very impressed because of the stride of what Lagos is doing in terms of climate change and health. And we are very honored to have him here. Dr. Abayomi was speaking on how can the government collaborate with the civil society in building an effective mitigation strategies against the climate change crisis. Professor, you have the floor, sir.
Good evening, everybody, and thank you very much for inviting me to speak at this session, and I'm particularly intrigued by the title of this side event. So those of you that don't know me, I work for government. I work for the Lagos State government. The Lagos State is one of the states in Nigeria. It's a coastal state. It is famous for being the mega city of Africa. It has a population of about 30 million people on a very small footprint on a coastal piece of land. It has about a third of its size is water, lagoons, rivers, and the seafront. Because of its population and because of its size, it's a very heavily dense human footprint, and that makes it extremely vulnerable to climatic shocks and to other biological events. So, for example, COVID spread like wildfire through Lagos throughout our 5 waves, because everybody is in very close proximity. So we're very, very nervous about climate change because we're coastal, we're low-lying, the sea is rising. Literally, you can see the sea rising every year. We've got 8 big rivers flowing into Lagos, bringing a lot of fresh water. Because the north of Nigeria is drying out, we have a lot of inbound migrants, coming to the center of commercial activity. So we have an inbound movement of people. You can imagine how much it takes to feed 30 million people. Can I get some water, please? Sorry, I've been talking all day, so my voice is getting a bit rough. Is this the loudest microphone you have? It's closer to my mouth. Okay, right. So we've got people problem, we've got density problem, we've got water sea problem, we've got flooding problem, we've got heat problem. So we're not going to sit down as a state that has lots of vulnerabilities to a shock, an environmental shock, and wait for these events to happen. So the topic of what you've asked me to speak around is how do we collaborate with civil society? Now, as soon as I took office, which was about 4 years ago, the first non-government person that I appointed was a high-ranking member of the civil society. And I established a civil society desk. Thank you very much. So we established a civil society desk inside the Ministry of Health. I mean, that's a very unusual thing to do. But we know that if you really want to have impact, you have to make civil society your best friend. A lot of government are always fighting with civil society because civil society are always pointing out their shortcomings and pointing out their gaps and pointing out their failures. Well, there's nothing wrong with that. You know, the best thing to do is to bring them in on your side so that when they point out your shortcomings, it's not so painful because you've heard it before. So we have a civil society desk, and what that does for us is, as government, because government is often quite displaced from the people, you know, so it gives you a voice of the people really right down at grassroots community, you know, where things are actually happening. And you're sitting in this little ivory tower, you're very far away from the people. You know, you actually make laws and policies, some of which are irrelevant. They have no consequences on community. So if you have a good, strong civil society organization inside your ministry, you get this information. It's fresh, it's real time, it's relevant. And that helps you to define your policies, your laws, your programs, and your projects. So your projects now become relevant. You develop your budget to implement your projects. Civil society come in again to give you an idea of how effective you've been implementing your projects. Because, you know, as a commissioner of health, which is my post, I can't be in the field monitoring what's happening. And the people that work for me may or may not give me the real picture of the reality. So I need ears and eyes at the community level. And civil society, they don't lie. They tell you the hard truth. You may not like to hear it, but they give it to you real, all right? And if you establish that relationship where, first of all, you're getting the information about what to do, for example, in climate change, you may not realize that people in the community, their wells are being salinated, you know, and when they're drawing their water from the well, it's really difficult for them to use the water. You know, you may not know about it. All you know is that you have 500 wells in this community, but you don't know that out of those 500 wells, 95% are not providing good enough water, you know. So you now need a plan to either take those wells deeper or put in a purification plant on the water so that the water that's coming out of the wells is useful for human beings. I'm just giving you a simple example that, you know, what you see from your high position in government is quite often, you know, clouded from the reality, you know. So you need civil society, and I love the way civil society operate. They're very networked, you know, and if you want information, intelligence about what's going on, civil society. If you want to implement projects, civil society. If you want to monitor your project, civil society. At the end of the day, if you're really a government that wants to have impact, then you really need to have a very strong civil society organization working along with you. Now, you don't want a group of civil society people that say things to you that you want to hear. That's not what you want. And you can quickly pick out when that is happening. What you really want to hear is the voice of the people at the grassroots level, because they are your main and your most important constituency. And you really want to, as a government, you want to have impact at that grassroots level. And so you want a truthful set of civil society operatives giving you that information, and you're operating through them to deliver. Now, for something like climate change, I mean, you just need to walk through these corridors, and I'm sure that 70% of the people at COP are civil society. You can tell civil society people, you know, they look different, they talk different, they're fairly aggressive, you know, and because they have a constituency and they're fighting for their constituency and they don't have time to waste, you know. So when you meet them, they give it to you, boom, 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 and you know, you've got to listen, you know. So if you want to be effective at a place like this, you really have to come along with civil society, and they'll take you to where you need to be. They'll take you to where you need to hear what you need to hear, and they'll take you to where you can actually get help for your programs in Nigeria. Before I finish, I just want to introduce my top civil society person in my office. She's sitting right there. Her name is Titi. Can you stand up? Titi keeps me on my feet. She keeps me informed. She keeps me monitored to make sure that as government we're delivering impact. So that's the way we collaborate with civil society. Thank you very much.
Thank you very much, Honorable Commissioner. Yes, it was the handwork of Titi that made it possible for you to be at this event. So that is networking. Thank you very much, Titi. Please, a hand of applause to the Commissioner for Health. Now, leaving Lagos, we want to move to the US, and I have Dr. Hufling here to talk on the global North and South collaboration, what way to build the capacity of health care professionals in mitigating climate change impact on public health. You have the floor, 5 minutes. Thank you.
Thank you. Thank you so much for inviting us to be a part of this here today. We're really happy to have, I think, the largest group of nurses ever at a COP. I've met more nurses here than ever, so this has been really amazing to have the nursing voice well represented. And it's vitally important that nurses are at the table. We're the largest portion of the healthcare workforce. There's over 28 million of us around the world. We're about 53% of the healthcare workforce. And so it's critical that nurses are engaged in these discussions, and we're solutions people. So we always say you can't get things done without nurses, and I feel it's the same with the climate crisis. But unfortunately, there's still a lot of hierarchies in healthcare. And so I feel like nurses really haven't been tapped to their fullest potentials. And as Pastor Peters and I have been discussing how the Global North and Global South can be working more collaboratively together, I feel like nurses could be a really lovely test case of how we can be making a positive impact on health. And nurses are just so primed right now to be engaging in this work. Just as an example, my organization, the Alliance of Nurses for Healthy Environments, has partnered with another healthcare organization, Healthcare Without Harm, for something called the Nurses Climate Challenge, where we've been educating nurses and then having them educate their peers. And we had a goal of educating 50,000 nurses before the end of 2022, and we just passed the 50,000 mark. Yeah, so we want to take this global. We think that there's just such an interest and passion in nurses as soon as they're educated around the health impacts of climate change. And thinking about the discussions that Pastor Peters and I have had, just last year in the British Medical Journal, some colleagues of mine had a really fabulous article published called Nursing's Pivotal Role in Global Climate Action. And they have 5 kind of buckets of how to make change within nursing to really build the nursing leadership that we know there's that potential for. The first is to accelerate change by leapfrogging nurses into leadership roles. We should be a part of executive teams, no matter where we are in the world. That we need to have nurses on international and national boards, Congress's government panels, like as part of civil society groups. Having nurses engaged through them, I think is very critical. And building partnerships among nursing organizations around the world, working together on climate action. And we need to amplify leadership and sustainable healthcare initiatives, both in the workplace and in our communities. Nurses are in every community, and when we're able to amplify the incredible work that's going on, it just builds exponentially. We need to pay nurses for their climate change work. We need to give nurses and nursing students the skills they need to create the future. I just love that. Being in the climate change space for a little while, we're always like, it's the greatest public health threat we face today, but it's also the greatest opportunity. And we can have such an immense positive impact on the lives of our communities when we address climate change. That we need to integrate planetary health, social determinants of health, health equity, and lifespan and occupational and location-specific vulnerabilities into nursing climate change education. I also love this one because I'm an activist at heart. Rekindle activism, advocacy, and relentless truth-telling. We need to amplify the voices of nurses to reach healthcare professionals, patients, families, and our communities. And we can extend the effectiveness of nursing by speaking truth to power to mitigate the effect of climate change on health. We need to ensure a global lens by extinguishing Western biases in the climate action agenda of nursing. We need to promote a stronger voice from nurses in low and middle income countries in the international climate action agenda. And we need to adopt successful climate change strategies developed in low and middle income countries as models for other countries across the globe. And finally, we need to put equity, justice, and morality front and center. Nurses, I think this is where our voices can be incredibly powerful. We need to call for health equity agendas to be central to climate actions, and we have to aim to achieve the Sustainable Development Goals for all nations. I think if we put health at the center and have nurses at the table working together collaboratively across the world, we can make incredible change. And one last pitch for this is we need funding to do that. We need funding for nursing education around climate change and really funding to help put nurses in all these communities, put nurses at the table. And we need our governments and foundations to be funding this vital type of nursing work. Thank you.
Thank you very much, Dr. Ketsi, for that insightful input. We're going to have a robust discussion after the sessions. So I want to move on to our next speaker. She is also a government person. I think we count ourselves lucky that we have two key ministries that are involved in the climate change campaign, represented at the level of governance from Nigeria on this panel. And so, ladies and gentlemen, it's my pleasure to introduce Dr. Oseji, who is the Permanent Secretary of the Ministry of Environment in Delta State. She's going to talk to us on the Niger Delta ecological disaster. What role for the health care professionals in mitigating the health impact? You have the floor, Mother. Please put the microphone to your mouth.
Hello. Good evening, everyone. It's indeed a pleasure to be here on this distinguished panel to talk about the Niger Delta ecological disaster. What role for the healthcare professional in mitigating the health impact? I'll start by giving one definition of disaster. It's an occurrence that causes damage, economic disruption, loss of human life, a deterioration in health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. Furthermore, it gives rise to what we know as internally displaced persons, IDP. That's someone who is forced to leave their home but who remains within their country's borders. So one of the major disasters we have experienced in recent times is the disaster of flooding. And my state, Delta State, has experienced series of these phenomena. I have in-depth knowledge about these things because even though I'm currently the permanent secretary of Delta State Ministry of Environment. I'm a medical doctor, a consultant, public health and community physician, and I was Permanent Secretary, Ministry of Health for 4 years and 4 months before being posted to Environment. And so I was very much involved, first as a director in 2012, then as a Permanent Secretary in 2018, 2019. There was flood in 2020, but because of COVID, the response was not as great as it was before. And then I used those experiences to support the response in the 2022 flood, which we had. The 2012 flood was before now the worst of its kind. We hadn't seen anything like that for like 50 or 60 years, we were told. But the one of 2022 was even worse than the one of 2012, because you could see the level of submerging of houses, whereas in the previous times you had houses being submerged to the middle of the heights, but this time they were being submerged up to the rooftops, so it was terribly bad. Now, what are the impacts, health impacts of such disasters? First, you can have mortality and injuries, which place a great burden on the affected community. Increased risk of spread of communicable diseases and environmental hazards, respiratory diseases, person-to-person infections, waterborne diseases like cholera. Disruption of the provision of routine health services, including preventive services such as family planning, antenatal care. Psychological disorders, you may have people coming down with anxiety, depression, temporary confusion, disorientation. Disruption of normal socioeconomic activities that could lead to drug abuse, alcoholism, destitution. Food shortage with the attendant consequences varying from malnutrition, starvation, with the women and children being more vulnerable. And then you could also have increase in diseases that have otherwise been endemic, and then casualties occur at time and place of impact. Assuming you have people that have suffered drowning, they have to be rescued, taken to the hospitals to go and have resuscitation. Now, what are the roles that healthcare professionals can display at a time like this? First of all, before the disaster management has 5 phases. I won't go into those details because of time. But the pre-disaster phase, before the disaster occurs, there's a lot of advocacy on climate change, mitigation and adaptation that needs to be done. Advocacy for better houses. Many of our residents, particularly those that are of low income, they live in shanties and settlements and camps. And those camps are the first to go whenever we have such disasters. So we need to start advocating for better housing as well as climate change. And then, when the disaster occurs, there are specific responses. I've mentioned the internally displaced persons. Usually we set up camps for them. And these camps will have clinics. And the clinics will provide routine health services, immunization, and so on. Now, you also need to ensure that those camps are sanitary. So the environmental health workers will go around, members of the health team, fumigate those camps, make sure that they are clean, make sure that they have proper toilet facilities and adequate water facilities. Then you make sure that there is provision of food, and you mobilize the disease surveillance notification officers for active surveillance and public health education to prevent outbreaks. You work with non-governmental organizations as well as professional health associations. I'm very happy with the comment on civil society, and I have continued to advocate that professional health associations should take a cue. So we have the Nigerian Medical Association, the Medical Women's Association of Nigeria, the Federation of Local Government Nurses, the Nigerian National Association of Nigerian Nurses and Midwives, and so on and so forth. They can all come together to make their own contribution to the response. And then you have to continue to monitor the sanitary situation in the internally displaced camps. And then I'll go on to round up by talking about when the disaster is over, what we call the rehabilitation phase. You have to encourage the residents to fumigate those homes that they have evacuated, because there'll be rodents, reptiles, and so on, so that they don't go back to homes and start falling down with diseases, coming down with diseases. And then you have to advocate for reconstruction and renovation of health facilities that have been destroyed by such disasters. Thank you. Sorry about my voice.
Thank you very much, madam. Now you all agree that nurses play a critical role, and healthcare professionals within the health system were the first line of defense during the COVID-19 pandemic. Now, we cannot quantify the number of nurses, doctors, and other healthcare workers that died during COVID-19. But you discover that most of the countries that you had this crisis more, if you look at their climatic condition, it also exacerbated the spread of the COVID. So, and that is why it brought a lot of work on the health institutions and the workers. That is why you find a lot of healthcare workers falling down sick and a lot of them breaking down, and which is why this is key. So I want to thank Dr. Oseji for our interventions, and we'd love to move on to another very mostly unspoken area of the healthcare discourse, and that has to do with ocean. Now, ocean as a source of sustainability, putting Nigerian maritime efforts towards achieving climate health. And to talk to us about that is Dr. Omar Perpetua Ofodile, the Deputy Director of Marine Environment Management and Head of Climate Change Department. You have the floor, ma'am.
Good evening, Dr. Peters and the panel members. Good evening, everyone present here. Thank you. We are happy to be here. I'm here with my team, the Nigerian Maritime Administration and Safety Agency, and we are happy to be given this opportunity to bring to the fore what the agency is doing as regards ocean health and also maintaining a clean marine environment. I am not going to start dwelling on what ocean is. It's already a wide knowledge. The world, about 90%, is covered by sea. And that goes a long way to show how important it is to human existence. And at the beginning of this session, the moderator had gone in depth to tell us about the importance of ocean and why ocean should be considered a priority on this issue of greenhouse gas emission reduction. Having said that, I just want to chip in that there are countless benefits that we get from the ocean. It is known by research and fact that ocean provides at least half of the oxygen we breathe in as human beings on Earth. The ocean also absorbs 50 times the carbon dioxide that is being emitted into the atmosphere, that is also causing these global changes that are so worrisome now on different perspectives. We also know that the ocean businesses provide countless jobs, especially to developing countries. About 170 million, as recorded by research, jobs on fisheries are being provided by ocean. We also know that about the 60% of the dietary protein we consume as human beings come from the ocean. And all these put together, among so many others, gives us the wide knowledge of how important the ocean is to us. And of course, when it comes to trade, 90% of the world trade is carried by sea. And that is where we come into. The Nigerian Maritime Administration and Safety Agency is in charge of ensuring that we have a healthy ocean, safe, secure shipping, and of course, clean marine environment. And what we do, we don't do in isolation. We are a member state of the International Maritime Organization. And whatever we do as a nation under maritime affairs, we align our activities with the IMO. And the IMO also has been given mandate by the UNFCCC to ensure that international shipping and maritime reduces its carbon footprint. And that is exactly what we are also doing as an agency in our own country. When it comes to ocean and health, NIMASA has been doing quite a lot. People always say, what does shipping or the industry have to do with health, with greenhouse gas? Initially, it was even difficult to understand our relevance on this issue. But being here this night has also opened our eyes to the fact that the efforts towards reducing emission from the globe is interwoven. No one sector can work in isolation. Every activity that comes from any agency dovetails into the other. Likewise, that of the NIMASA. We know that vessels run on heavy fuel oil, and this heavy fuel oil has sulfur oxide as a major component. And of course, my colleagues, fellow panelists in health sector will tell you the effect of sulfur oxide on human beings. Sulfur oxide is one of the very dangerous gases that causes respiratory problems. And IMO recognizes this. That is why they have gone to enact several laws to minimize the quantity of sulfur we have in bunker fuel oils. And now, from about 3.8% sulfur in every heavy fuel oil, they have brought it down to 0.5, which means any vessel running locally or internationally must have the fuel oil with not more than 0.5 sulfur content in it. Let me get some water. And furthermore, there are also other aspects of health we are looking into. We know that now there is a serious call for marine litters. A lot of litters in the waters are also affecting the climate in different ways. When it comes to the garbage part of it, we know that methane is a gas that comes from garbage. When garbage ferments, it emits methane. Methane is another serious greenhouse gas, and the agency has been working very hard at ensuring that we carry out marine litter cleanup so that our ocean will be free of marine litters. So we do that annually just to maintain ocean health. Amongst that, we also, the NIMASA is also engaged in a seafarer development program. It's a support program where they give sponsorship for seafarers to go and study on different areas. Yes, it's been, grooming engineers, architects, and cadets for the vessels. But now, there is a futuristic outlook on health, how we can begin to also extend that opportunity to health workers, the doctors, the nurses, to be part of this issue. And also at the same time, we have a search and rescue clinic, and they work with the seafarers, and they also work to ensure that if there are accidents, sicknesses, diseases like during the COVID period, we have professional handy people to come in on maritime, from the maritime angle. And these are so many more. I could keep talking, but the 5 minutes given to me, Pastor has been looking at me, but not afford me more opportunity. I could go on and on and on to let this gathering know that the Nigerian Maritime Administration and Safety Agency, aligning its activity with the International Maritime Organization, has been doing a lot to ensure that the maritime industry reduces its carbon footprint, and at the same time recognize the importance of health and the health workers in our activities. Thank you.
Thank you very much. I'm sorry if I was looking at my time, but I didn't mean to be rude. But I can assure you, COP28 promises to be better and greater, because then we'll have a lot to do together as an agency and as an organization. And so there's somebody I want to introduce right now. He's going to join us virtually. He was the former designated Nigerian National Authority. That means he was the first national focal person on climate change, and the former technical advisor, African Union on climate change. He is the co-founder and vice president and group managing director of Greenpeace Africa Limited. Ladies and gentlemen, I want to invite Dr. Victor Fudeke to take the podium. He is going to talk to us on tapping on available resources in building the capacities of healthcare professionals in mitigating climate change. Dr. Fudeke, sir, you have the floor.
Thank you very much, Pastor Peter Omorago. It's distinguished excellencies on this great occasion. It's a great pleasure to be with you virtually. And as you have rightly said, the lives of people who have already moved on as a result of COVID-19. May I kindly request distinguished excellencies on this program to observe a 1 minute silence by standing up on their behalf. Am I permitted to do that? Hello?
Yes, we are out. Yes.
Hello?
Yes, we are observing the 1 minute request, sir.
Thank you very much. May their soul rest in perfect peace.
Amen.
I want to put on record the excellent, indefatigable effort of Pastor Peter Omorago, who has unrelentlessly working to ensure that human health becomes an issue of the Conference of Parties. Before the world knew about this in 2014-2015, our organization signed an MOU with the Federal Minister of Health in Nigeria, and that agreement set the ball rolling throughout the whole world because Nigeria was the first. Now, within the minutes that you have given to me, it is very, very clear that the world is approaching what is called code red in terms of what is unfolding with the extreme weather phenomenon. I don't intend to speak much, but to put a proposal on the table for us. Following the success of COP21 in 2015 of the Paris Agreement, especially through the singular effort of former President Obama, that was a watershed event of the Paris Agreement. I wish to propose as follows. In collaboration with nurses across the borders, Greenpeace Africa hereby proposes to incentivize efforts towards global carbon management by proposing an international Hall of Fame on net zero carbon 2050, which will be unveiled in COP28 in Abu Dhabi, UAE, next year. That proposal will put to incentivize all efforts to ensure that public-private sectors that demonstrate in a race, that in a race, only very few people get to the end and they also get the reward. Such a proposal will have different sections to reward organizations that are involved, first of all, in enhancing the capability of the health institution to green the health institution by providing them clean energy. Now, it will be a record that will be noted that next year, COP28, International Hall of Fame will be unveiled, and during this period, there will be an International Board of Trustees that will be worked between the two organizations of Green Plains Africa Limited and Nurses Across the Border. And we believe that this will drive home of support that is needed, that before 2050, even before 2030, we can avert the negative consequences of this climate-induced disaster. Because what we are experiencing today is as a result of the emissions that were released 50 years ago. You can expect, just as what happened with flood 10 years ago, which I was a victim when I was traveling after coming back from one of the meetings of the Compliance Committee Enforcement Branch. I had to leave. I wanted to travel from Lagos to Abuja. The airlines were on strike, so I had to come by road. When I reached Lokoja, I was told that it would take 3 days to cross a journey of 15 minutes. That was my experience in 2012. Not knowing that this year was just, I can say, the grandmother of all the disasters, but we have seen nothing yet. And I believe that efforts by private sector, public sector, individuals, towards ensuring that it never happens again, and we work together through the establishment of the International Hall of Fame for Net Zero Carbon 50 will be a program to incentivize efforts of reaching this goal before 2030. Thank you very much.
Thank you very much, sir. Thank you very much, sir. Thank you for joining us all the way from Abuja. Our time is fast spent. I just want to quickly call on our last speaker before we have a 10 minutes interaction. And like I said, he was a two-time mayor of Ikoseji local government in Ekpel division of Lagos State. When we started our campaign on climate change, Ikoseji supported us across the borders, not just financially, but what they did, they also brought into the campaign, and we began a collaboration. And it is that collaboration, it is the story of that collaboration that Honorable Ganyu Adetola will be talking to us about. That is grassroots mobilization, the Ikoseji local government council, and Nurses Across the Borders story. You have the floor, sir.
Thank you very much. Good evening, everyone. My name is Adetola Ganyu Olusegun. I served as the executive chairman of Ikoseji LCD Ekpe local government in Lagos State between 2008 and 2014 for 6 years. So since that time, the local council development area have been collaborating with Nurses Across the Borders, and till now, the present executive chairman, Akogo Anomo, still join in collaborating with Nurses Across the Border. So far, so good. The relationship between Nurses Across the Border and the local government area have helped a lot. We're able to mobilize more people because the local government is the third tier of government and closer to the people, closer to the community. So that gives us opportunity to be able to relate with the people in the community. In fact, we're able to introduce them, and with the assistance of Lagos State government as well, tree planting campaign. If you cut off a tree, that means you have to plant 2-3 trees back, so that this will be able to lessen the negative effect on climate change. And then since that time, nurses across the border with the local government. I've been engaging in free health program. We provide free drugs, free blood pressure tests, and sugar level tests and all this stuff. So with that, the nurses across the border provide nurses and doctors assisting the people. So with this method, we're able to now convince as many people as possible to let them understand the climate change, to let them understand why they have to stop cutting forests, why they have to stop cutting trees, because they see it as a means of livelihood. They go into the forest, they cut trees, cut into pieces, and they sell. Sometimes they turn it to charcoal, and you see people still make use of the charcoal to cook, which is not even good for them. So with this, they don't really understand. So if we are here and we don't really go to the grassroots, that means we are not really communicating. We are not really passing the message. So with the assistance of the local government and the nurses across the border, we were able to reach out to the people in the community. And since then, we've embarked on sensitization program, which have been helping. And quite numbers of people have really joined nurses across the border. So as I speak, we have over 100 people that are willing and having interest in working with nurses across the border to ensure that the message being really passed to the grassroots. So thank you.
Thank you very much, Honorable Adetola. If, because of time, but we'll plan for COP28. Distinguished gentlemen and ladies, you had different speakers spoke on different topics, but we all have one meeting point, which is the health of mankind. No matter the campaign, no matter the level of campaign on climate change, the only index to which you can measure the success of that campaign is the impact on your health and my health. And that is why this discourse is very key. That is why collaboration is very key. That is why we want to engage government. That is why we are very proud that yes, ministries of health like Lagos State Ministry of Health could engage the first civil servant in this ministry as a civil society person, which underscores the importance of engaging with civil society. But you also agree with me that there is a problem with most of the ministries at the federal level. For instance, the Federal Ministry of Health the Federal Ministry of Environment in Nigeria, to me, from my observation, have tend to monopolize the issue of climate change campaign. They do not, in all honesty, engage line ministries in the activities of climate change. Line ministries like health, agriculture, water, science and technology. These are line ministries and the maritime industries. But the issue is that the space for climate change activities is so wide that yes, one ministry cannot attend to it alone. That is why ministers across the borders are engaged in sensitization programs like this to draw the government's attention to account on the need that yes, there's a lot to be done on climate change and climate health. We need to build resilient climate health institutions that can withstand the impact of climate change. And so I want to open the floor for discussions and comments and questions for members of this panel. So we have just 5 minutes to do that. If you have one question, I can recognize you, Madam, number 1, number 2, 3. So just 1 minute, 4. 1 minute each for, yes, thank you very much. Introduce yourself and tell us where you're from. 1 minute, thank you very much.
Thank you. My name is Yeda Machage from Kenya. I work with the National Hospital Insurance Fund, recently rebranded Health Insurance Fund. NHIF is a primary driver selected by the government for Kenya for universal health coverage. So my question goes to Dr. Oseji, the Permanent Secretary. In the Sustainable Development Goals, The UHC now is measured by both a service coverage index and the financial protection index. I've heard you mention something on the implications of climate change on service coverage, but there seems to be, as I was sitting here, because I've been here the entire week, there seems to be a gap in maybe resulting also from climate change and its impacts on financial protection. Financial protection being impoverished expenditure, catastrophic expenditure, the number of people who are pushed lower with regards to poverty levels, and those who also experience high out-of-pocket expenditure. I am yet to tie climate change and the effects of it on financial protection. I would like to hear from you whether we have substantial studies on the same or your comments also on the same.
Thank you very much. Okay, fine. That is okay. Fine. Please, yes, number 2. Yes, thank you very much. Yes.
Thank you. My name is Ahmed Abari from. I have a question. Hello. Hello. Okay. I have a question for Professor Akomi, the Honorable Commissioner of Health in Lagos State. Professor, it's a pleasure being in our mix today. We all recognize. Thank you. We all recognize and appreciate the good things you did to Lagos State and Nigeria during the COVID. You were all over the places trying to rescue lives. We are grateful for that. I want to ask this question. Giving us the initiative of bringing up the civil society decks into the governance for obvious reasons of policy development, implementation, and even execution. Could you initiate through the Nigerian Governors Forum, which I know is a peer review initiative, how this initiative can be institutionalized for adoption by government in other states? Because I know the issue of civil society has been of serious challenge to other government. Second question, if you allow me, the moderator.
One question.
To Dr. Oseji, the Permanent Secretary, Delta State Ministry of Environment. Madam, you have, from your presentation, you have a quite experience on the medical, given your background. And you have also told us the effort you've made in contributing to humanity. But my question is, could you initiate or advise government on the response time on issues of climate-related challenges? I could see the last challenges we have regarding the flood in Nigeria. I know the issue of response time has been a serious issue. Some victims have spent days, weeks without even getting response from even their immediate community. And if we talk of health, the response times is key to saving lives. So how could you tell us about the improvement on the response time?
Thank you very much. Number 3, thank you very much. Please, to your question, we have just 5 minutes to answer these questions.
Hi,
thank you.
my name is Nanine. I'm a medical doctor and researcher in South Africa. I'd like to thank everybody for what you shared today. It's very inspiring and great work. My question is to anyone on the panel that would like to answer, considering the title of the event is the health implications of mitigation strategies. We know that animal agriculture is one of the leading drivers of climate change. Where do you see the advocacy for adoption of plant-based, plant-rich diets and meat reduction diets in healthcare at the moment? To anyone.
Thank you very much. That's number 4. Okay. After that will be last. 1 minute, please.
Well, I am Rex Anigoro, activist Rex Anigoro. I am activist Rex Anigoro from Delta State. The Senior Special Assistant to the Governor of Delta State on civic engagement and civil society. So I can appreciate the fact of what you have said, engaging with the civil society. I am happy that you are doing this at the level of the Ministry of Health in Lagos. I want to find out, do you still also have this kind of level of engagement as a state government where the civil society is engaged at all levels for the good of the state? For example, in my state, that's what we have. We have a Delta State civil society community, which when I came into office, we helped to establish. And so it's easy for you to be able to engage at all levels, whether health, whether education. You just go and get the data and you say this civil society engages in this and that. Do we have that in Lagos for the purpose of
thank you very much.
Thank you.
Noted. Last questioner.
Thank you.
Close your mouth, please.
Thank you. My name is Haitha Susan Wasubire.
Please close your mouth. Close your mouth very well. Yes. Speak louder.
I'm Haitha Susan Wasubire, a climate change scientist with Climate Action Network Uganda. Mine is both a question and I would say a suggestion. Now this can mainly go to the Ministry of Health and Ministry of Environment. Now I noticed that in most of the deliberations and also the work that is being done, emphasis and focus is being put on the ecosystems, and very little focus is being put on ecosystem services. And these are the benefits that we enjoy. Now, my question is that what is the ministry, both the environment and the Ministry of Health, doing to ensure sustainable ecosystem services are being preserved and special focus is being put on them to ensure that we continue to enjoy these services decades to come? And then my advice is that in your advocacies, in your deliberations, please include the ecosystem services, because they are completely different from the ecosystems. The ecosystem services, to be sustainable, there must be special focus put on them. Thank you.
Thank you very much. We have 7 minutes to be out of this space, and I'm going to give each of our speakers 45 seconds each to address the questions so that we can conclude our program. So we're starting with Dr. Oseji. Thank you very much.
Okay, I wish we had a clock to be ticking. Climate change and financial protection. What we did in Delta State was that we provided health services that was free. Now, Delta State is one of the best states in universal health coverage in Nigeria. We have had a free maternal and free under 5 program since 2007-2010 respectively, and with the current administration in 2017 it went on to insurance. So we have about 1 million people that have been enrolled in the insurance scheme, and the strategy we implemented was that during the period of the residents in the IDP camps, they were introduced to the insurance scheme. Another question for me is the time lag. One of the things we fail to do in government and civil society is adoption of best practices, but you can't adopt if you don't document. So I believe that all of us who have participated in responding to the recent flood disaster, we should document what we have done, circulate it widely, and those who read it should adopt it, learn from our mistakes and improve on them. And then finally, from Uganda, a focus of ecosystems. That's quite interesting. Because I was in Ministry of Health, I knew about the traditional medicine board that ran our botanical garden. And when I went to Ministry of Environment and I asked them what they were doing for botanical gardens and things like that, they said there is nothing. And I said, what about the traditional medicine board? They said it doesn't exist. I said, that's because you don't know. So now go to the traditional medicine board, set up a collaboration so that we can do a lot more on the ecosystems. Thank you.
Professor.
Thank you. So the question around Governors Forum, yes. So I believe, you see, governance is a personal choice. You know, not everybody wants to govern with an open page or an open strategy. I believe it works for me because it works both ways. I get information and my policies are targeted in a very effective way. I take your point, and I believe that it can be introduced through the Governors Forum, and I will mention it at the next opportunity. The other question, civil society, yes, we have a special advisor for civil society like yourself, whose main function is to engage multiple high-level engagements in community. But I believe you need to break it down into each agency to be effective. And then the issue around protein, yeah, very important question. We are very interested in cellular protein, you know, which is steak or fish or whatever that is not animal product, you know, but is made through biological processes. I know South Africa is big with that. We also are trying to adopt that in Nigeria because we just have too many mouths to feed and not enough space to roam cattle or sheep or chickens or whatever. So I think a time is coming where, you know, we have to start thinking about developing protein that's not animal-based. Thanks.
Thank you very much. Thank you very much. Please, a warm round of applause for the speakers. Thank you very much. Thank you very much. I'm going to introduce the last speaker who is going to give us a vote of thanks for just 2 minutes, and then we're going to have a group photograph of all the speakers on board. So please join us and welcome Mr. Alabo James. Quickly, 2 minutes.
Thank you, Mr. Moderator. I'd like to thank our very special panelists. Now, first of all, I'll start from my left. I want to thank you, sir, Pastor Peter Omoragbo, for your resilience on how you have been championing issues on climate change. I want to thank Dr. Mrs. Ofodele, the director in climate change in NIMASA, for telling us about the reduction, what the agency is doing on reduction on carbon in sulfur. And then Professor, sir, thank you. You also told us that for us to go forward by way of relieving the impact of climate change, we have to work with the civil society. And then Dr. Hofflin, good. Hofflin told us that we should train nurses to be in leadership role. And then our honorable, thank you, sir, Mr. Honorable Gani, you told us that you've been doing health programs, free health programs like BP checks and all that. Thank you, sir. And our PAMSEC, we are glad to have you here. You also told us that we should advocate for better houses. We thank you all, and I want to thank the in-house audience. Thank you very much. Together, we are all champions. See you in COP 28. Let's do this again. Thank you very much.
Please, you're going to do something for me. Just one word, because we're going to have a group photograph. You just repeat after me. Together for implementation. Just at the count of 2, just say it. Together for implementation. 1, 2, go. Together for implementation. I can't hear you. Together for implementation. Thank you very much. So please, want to have a group photograph. Somebody to help Mr. Barry. Use this camera.